Good evening, ladies. This is Folake Ogundele, your Yellow House sister. I hope we've had a stress-free day. Today, I'll be taking like 20 to 30 minutes of our time to discuss an issue that gradually becomes important to people who are 40 years and above. I hope at the end of the session it will be worth our while. Thank you very much. So, the title of our session today, this evening, is Befriending August, the Kids Escaping Dementia. Now, the question is this: who is August? Why do we need to befriend her? In fact, why do we need a key to escape dementia? It's not as if we all have dementia, do we? These are the things we'll be discussing today. But before we talk about dementia, let's talk about the first person to befriend August, and that is Aloy Alzheimer. He was a German psychiatrist. He died relatively young at the age of 51 in 1915. And he had met August. August was a patient in the hospital where he used to work. He met August a year after his wife died. By that time, he had put himself really into his work. And August for him was particularly unique because she had symptoms which were like symptoms he used to see in people who were old. When he saw those patients in his elderly patients, he would just assume that, oh, well, this is acceptable for people in their old age. But when he saw August, August was just 51 years old, and she had symptoms like his other elderly patients. So he was interested in her, and then he began to work closely with her. He began to document his findings. When August died 5 years later in 1906, he requested for her brain and also her medical records and did a post-mortem on the brain. His findings at that post-mortem was presented by him at a conference a year later, but his writings were not found until 1995, which is almost 100 years later. His senior colleague was the one that named the disease after him. Until today, we have what we call the Alzheimer's disease, which was named after his findings. So he was the first person, like I said, who befriended August, and his findings are still relevant. They form the basis for what we use to make the diagnosis of people with Alzheimer's disease, even up till today, over 100 years after his work. So now we'll be talking about August and why she's important to us. This is August. She was a German woman married in her lifetime. She was admitted to the hospital where Alzheimer used to work 5 years before her death. She died at the age of 56 in 1906. And the major complaint that she had was she used to say to people in response to whatever they asked her, or even when she was trying to undertake a task. And then she would say, "Ich habe mich verloren," meaning I have lost myself. I have lost myself. Another phrase she used to say was just to say, "Oh God," as a sign of helplessness. And that was the major reason why they brought her. Other reasons why they also brought her was because the family found her to have become increasingly jealous. She was unable to take care of herself, and she constituted a nuisance, so to speak, to her neighbors. Even while she was she was on admission at the hospital. They found out that they could not allow her to freely roam about the grounds of the hospital because she was always touching other patients who used to beat her up. And then she was always hiding things and always having problems with her memory. She was forgetful and she would frequently lose herself even in familiar environments. So that was the reason why they brought her. These symptoms, like I said earlier, were not unique to people that Aloy had found, but it was unique to him because it started while she was young. It started while she was just about 51 years old. And she needed continuous admission till her death. Even her death was because of the continuous admission, because, like I said, they could not allow her to roam about. So she was frequently tied, and she developed bed sores and had infection, which led to her death. Her case is unique because we need to understand the reasons why this illness started, and how do we prevent it in ourselves? What do we need to do to make sure that we don't end up like August? If you look at this last picture, you would see, I said it's all about the synapses, it's all about the connections in the brain. That's everything that we are. Who we are, what we stand for, our person, our personality, the way we judge things, our attitude, the way our heart functions. It's all about the connection of the brain cells. It's how well the brain cells are connected and the integrity of the cells and the integrity of the connections. Anything that tampers with these connections is a problem. It will change who you are, who we are. And so that is what we must continue to protect until we die. It's when the cells are no longer firing that you have to declare somebody dead. And this is the problem that August had. This is the problem that, as far as you grow old, you may have problems with. That is what old age and dementia is all about, protecting the connections in the brain. You can see that these brain cells that we see here, the connections, the strands are well outlined. You can see the brains connecting, you can see them joining together and firing together. They must continue to do that. When it begins to slow down, it begins to have memory problems. So, how do we know when someone has memory problems? How do we know if our memory is good? Because from about the age of 40, our brain begins to slow down. Not that we become forgetful, or not that we necessarily lose cells, but the rate at which the nerves conduct information begins to slow down. And so we might start becoming a bit forgetful, which is normal. But how do we know whether this forgetfulness has become abnormal, whether it is in the range of a disease or whether it is just normal old age forgetfulness? There are some things that we could pay attention to, and that will give us a clue. When you are forgetful, and you yourself, you agree that you are forgetful, it is said that that forgetfulness is normal. There are times that you are calling somebody and then you begin to call different names. You make mistakes with names. Say, oh, Falake, sorry. Oh, Buki, sorry. Shewa, sorry. You, if you know the person that you're calling, if you are sure that this is the person that you mean to call, even though you may make mistakes with names, it shows that your memory is good. If you enter a room and then you seem to forget why you're there, and but you know that, oh, there's a reason why I came here, it's likely to be normal, because really for that one, it said that entering a new room, it's there's a phenomenon that causes you to forget why you went to the room in the first place, as long as it is not often. And then if you remember faces that are close to you, familiar faces, people that matter to you, your close relatives, and you tend to forget people that you don't see often. That's said to be normal. If you remember the dates and the significance of dates, if you remember the day, today's day, today is Tuesday. This is We are in the month of February. This is 2022. If you can remember things like that, but you might forget whether it's 23rd or 24th, especially when you're not working with the calendar, is said to be normal. But by the time somebody is forgetting the dates, is forgetting the significance of the dates, forgetting the year, then there is a problem. So if you're able to manage your fears, if you are able to plan your life, if people are not complaining that this person is always forgetful yet keeps denying that he's forgetful, if your personality is not changing, and if your personality is changing, people will tell you. So you find out that people are complaining about you. They are ever saying, they are maybe saying you are no longer outgoing, or you are becoming overly friendly, or you are becoming like a nasty person, or you're becoming almost depressed, and people keep complaining about your personality. Subtle changes though, then, and you're becoming more forgetful, that would give a clue as to if this is a disease or this is just normal forgetfulness. If you are not missing appointments, if you are not missing key dates like birth dates and things like that, then it's still normal forgetfulness. If by the time people begin to tell you, you've said this before, you've asked me this question before, and it's happening regularly on a day-to-day basis, people keep complaining that, what, you have asked me this question before, you just asked me this question, or you just told me this story, that will give you a clue. And then you will find out you are having more problems with things that happened recently than remembering things that have happened so long, so far, though so long in the past. That should get you worried, and maybe you need to go for a memory checkup. So these are the few clues to memory problems versus a disease, a dementing illness. Okay, so what is dementia? Alzheimer's disease is a type of dementia. There are different kinds of dementia, but what exactly is dementia? Dementia, for easy understanding, we can say loss of memory and loss of ability to function. Now, brain functions are definitely more than memory. You have memory, you have attention and concentration, you have calculation, you have executive functioning, which is our ability to plan and organize. So I need to do several tasks during the day. I need to take my children to school, I need to get to work, I need to cook, I need to do all these things. You need the brain to be able to tell you how to plan your time, how to organize, how to prioritize. So these are some of the things that the brain does. Apart from orientation, being aware of who you are, where you are, who people are to you, and what time of the day it is. These are the things we do with our brain. We talk with our brain. We understand what people are saying to us with our brain. That's the speech. And then we can verbalize what we are thinking. We can work every function of the brain. When there's dementia, it gets impaired, because dementia is a neurodegenerative disease. What do you mean by degenerative? It means that the brain cells are degenerating. They are losing their integrity, their ability to connect. We talked about connections. So the connections are weakened. Some connections are totally lost in dementia. And so what we will find are people who are not able to remember things, who are no longer able to plan, who are always missing their ways because the orientation is not there. So they may miss their ways in familiar places. They may miss their ways in the neighborhood. There's a recent story. I think Taiwo sent it to us on this forum about a man who said his mom got missing at Yaba. So you have other elderly people who go missing sometimes because they are not able to locate themselves in their environment. You also have people who may not be able to talk well, or you give the same response to any question you ask them. They begin to forget names of people, and then they begin to forget faces, familiar faces. You ask a woman who is this person to you, is supposed to be her son, and she says, is my husband, or she says, is a neighbor, or she just smiles it off because she cannot remember. And then usually, particularly for Alzheimer's, you have memory starting first, and faces, familiar faces. You ask a woman who is this person to you, is supposed to be her son, and she says, "Ah, he's my husband," or she says, "Is a neighbor," or she just smiles it off because she cannot remember. And then usually, particularly for Alzheimer's, you have memory starting first, and so the person may begin to forget where they kept things and will start looking for it. Over time, you start accusing family members of stealing their things, may start um getting really upset and very difficult to live with, maybe because their personality is also changing. They also lose ability to function independently. They become dependent on others. They are not able to carry out their activities of daily living. What are activities of daily living? Activities that you need to be able to do yourself from day to day to live independently, like bathing, feeding, going to the toilet, urinating, defecating, dressing, taking our bath. So you find that the people may no longer be able to do it. It may start gradually and then continues to worsen. So you might find this woman who's, because she's not able to locate the toilet, she might go to the kitchen. There was one that was actually very distressing for the family members. The man went to urinate in their pot of soup, things like that, and then dressing, they may go to the bathroom, they may just pour the water on themselves and come out without actually um sponging their body. And over time they may not even be able to even do anything at the bathroom. The family members have to take over. Usually they will end up needing a carer, to do these things for them. And in the initial part, they may constitute a danger to themselves. They may put on the gas without lighting the stove. There was a woman who had to tell the husband, "Stop, you have to lock the kitchen," because she will go to the kitchen, she will put on the gas, and afterwards start looking for matches. So it can be dangerous. They may forget food on fire for a long time. So these are some of the changes that may start to occur, particularly for people handling money. Sometimes we need to bring in somebody to supervise their money, because especially for people maybe selling at home, they give you buy something worth 200, give them 500, they may give you change of 1,000. So calculation problems generally. And then over time, they have behavioral problems too, and personality problems. That personality begins to change. Maybe from being an extrovert, they may become an introvert. They may not say a word throughout the day. Or somebody who was generally like an introvert may become talkative, over familiar with people, intrusive. Personality changes, or will just be irritable, get annoyed. It can be really overwhelming for the family. Behavioral problems, they can sleep poorly, they have a searching behavior. They're always disorganizing the house because they can't remember. They're always searching and searching, and moving things and accusing people of stealing their things. So they may become depressed. For people that have awareness that they can't remember, they may become sad and really depressed. And you see them, they sigh repeatedly, they cry, they may just talk about people who have died that they remember. Memory loss is usually more for things that are recent. So they may remember more of things that happened in their childhood than things that happened yesterday or recent years. And they may also become, they may hallucinate, hear voices, see things that other people cannot see. They can be very destructive. They can become very aggressive, hitting people, touching people indiscriminately. So these are the symptoms of dementia, and usually would continue over a long period of time, usually greater than 6 months to years. And in our environment, however, most times memory loss, they don't present. It's because of these behavioral problems that they present. Because the behavioral problems, they cause a lot of burden to caregivers, and they are a source of concern because of stigma, because it begins to look like a frank um psychiatric illness. So that's why they come to the hospital. Dementia is a raging menace. Why do we say so? Every 4 seconds, one person is diagnosed with dementia. Presently, about 40 million people worldwide are living with dementia. Dementia, we say, is a disease of the old. Not that every old person will have dementia, but dementia increases as people get older, such that in people that are about in people that are about 60 years old, you have about 1 to 2% of that age group having dementia. But at the age of 80, you have 20% of them having dementia. So if you have 10 people who are 80 years and above, at the very least, two of them would have dementia. And dementia has a lot of economic, social, implications, because when somebody with dementia is in the family, you need to take care of the person. There needs to be somebody caring for the person financially and also attending to the physical needs. And so that is why we say dementia is very, very important. It's one of the top 10 causes of death worldwide. But aside just the number, in terms of mortality, in terms of the burden, it is the one that we are most powerless about. Very little is still known about dementia compared to other top, you know, um, daily diseases. So that's why we say dementia is very common. It occurs in every race, it occurs in every uh, status of human beings. So you have it everywhere. So the easy way to understand the causes of dementia is just to look at this picture. And if you look at this picture, this man is the janitor. And if you look at him, the first part of the picture is smiling, and then the second part is just really looks like he's throwing a tantrum as if he's very angry. So, with the way to just understand it is like the angry janitor is the one causing the dementia. When he's happy, he's cleaning, he's making sure everything is going on well. He's making sure there are no blockages. He's making sure that the the road for these nerves to connect is clean, is clear, is unclogged. But when he becomes very angry, maybe because of too much stress over time, maybe because of toxins, if the stress is too much, he's been cleaning and cleaning, and then when he's overwhelmed, he just starts to throw a tantrum and then begins to throw things around, begins to scatter things instead of cleaning them and arranging them, begins to scatter things, clump things together. He begins to get annoyed. He's not cleaning anywhere. He's not, arranging things again. Rather, he's scattering it. So to look at dementia and ask ourselves what is the cause, we should think about the angry janitor. So anything that can make the janitor angry, anything that can overwhelm the janitor will cause this type of cascade to occur. So what are the causes of dementia? To start with, we have the reversible causes and the irreversible causes, the treatable causes and the untreatable causes. The untreatable causes are much more than the treatable causes. The untreatable ones are about 85% that you cannot treat, meaning that you cannot reverse it. The person cannot go back to who he used to be at the beginning. But some treatable ones, like people that have vitamin deficiencies, people that just had some mild brain injury or some alcohol brain injury or some infections of the brain, which may resolve when you treat the infection, or people that have kidney problems and you may have some urea, problems, and then when you treat, they get better. But most often than not, you have the untreatable ones, and those are the common ones. Part of the untreatable ones is the Alzheimer's dementia, which is the commonest. It occurs in about 60 to 65% of cases. Another common one in our environment is the vascular dementias. These are the dementias that arise secondary to stroke. And you have people checking their blood pressure, checking their blood sugar. They're not checking their cholesterol. We don't check cholesterol. Cholesterol is just as bad as the blood sugar and the blood pressure. the effect is just as bad. Or people that have had stroke, and then we we say that it's partial stroke. I don't understand. Partial stroke, that word partial, it really has no meaning, because partial, just the way I see people, the way they understand it, partial means that the person does not have motor symptoms, or the motor symptoms resolve. So the person was not able to lift the hand initially, maybe within a day or two, the symptoms resolve. But the impact on the memory can be even be worse than even the one on the speech or the motor. So really, let's discard that word partial. If anybody has had stroke and the person is lucky enough for the symptoms to be resolved, you must take it serious and not just disregard the symptoms. Then you have the Lewy body dementia. It looks a lot like Parkinson's dementia. You have the frontotemporal dementia. You have different kinds of dementia. There are so many, and that would determine maybe what the cause or the features of the illness. So, if we say that dementia is a disease of the old, are we saying that everybody, as long as we get old, particularly if we are over 80 years and above, that we're all going to develop dementia? God forbid. But apart from God forbidding it, there was a study that was done in the US on nuns, about 600 of them, that forms the basis of our scientific assertion. And what exactly was the study all about? It monitored nuns throughout their lifetime, and also they did postmortem on the brains of the ones that died. And they found essentially two things. They found two groups of people: one that had mild symptoms of dementia or no symptoms relatively, and those ones, when they checked their brain, for some of those ones, they found out that for some of them, there are the signs of dementia in the brain. I talked about clumping together, like overcooked spaghetti. You will not be able to identify individual strands, and then you have places that are clumped together. They found that those symptoms in the brain, they were mild. Now, they now found another set who had severe dementia in life. But when they checked their brains, they found that the changes in the brain they were not so significant. The brain changes were just mild to moderate, and they had severe symptoms during life. Whereas some had mild dementia during life, when they opened their brain, you could say that the brain was finished. There were no, the integrity of the cells were really, really bad. And so they checked their lifestyle. They went back to the books and checked their lifestyle. And they found that the ones who had mild symptoms in life, but who had significant brain changes, were the ones that led engaging lives. They were the ones always into gardening, reading books, playing music, dancing. Those were the ones that had few symptoms in life, but really bad brain changes. And so it led us to the conclusion that the way you use your brain determines a lot what happens at the end. If you are active, if you are engaging the brain, if you are doing mentally stimulating activities, the brain integrity will be maintained relatively more than the other people who will not, stimulate their brain. So that leads us to what are the risk factors and how do we prevent? Okay, so some risk factors. So if we say we are not too sure about the causes, what about risk factors? Things that will make you and I prone to having dementia. Those are memory problems, particularly as we grow older. The first thing, if you look at this last picture that I sent, is the age. The older we grow, the more the likelihood of developing dementia, such that people that are 60 years old, just about 1 to 2% of them would have dementia. But with each 5 years, the rate doubles. So by age of 80 years old, at least about 20 to 25% of people that are 80 years old will have dementia. There's no running away from it. So we say that dementia is a disease of the old. Not that every old person will have dementia, but the higher percent, the older people are, the more the likelihood of them getting dementia. What are the other risk factors? We say something like genetics. Genetics predisposes to dementia. It runs in families, so to speak, particularly when you find Alzheimer's particularly in a family, you may still find over time generations coming down with dementia, particularly those that have the ApoE allele. That's a really technical thing. You need not bother. And then when there is a genetic risk, it's likely to occur at a younger age compared to those that are just sporadic cases. So if there is a genetic link, if the grandmother had it, if the grandfather had it, it's likely that, and had it at the age of about, let's say 75, 78, the younger age group may start to have it from about the age of 70, 60. So that is genetics. And then we know stress. The more you engage in stress, the more you undergo stressful reactions, you are everywhere today, tomorrow, and there's that perceived level of stress. It causes so much um, reactions in the brain. There's inflammation of the brain. That's the way I can put it. And that is predisposed to having dementia. Sleep too. Anytime somebody is not sleeping, it's like poison to the brain. It's toxic to the brain. You must have good sleep, particularly night sleep. That's when your melatonin is working. That's when the growth hormone is working. That's when the restorative effect of sleep must occur. You must sleep in the night. Anytime you're not sleeping at night, you're poisoning the brain. So people that do not sleep well are likely to develop memory problems, memory disease later in life, not just problems, diseases later in life. And then people who have the metabolic syndrome. What is the metabolic syndrome? People that have hypertension, people that have cholesterol problems. Most times we don't check our cholesterol problems, our cholesterol level. We check the BP, we check the sugar, we don't check the cholesterol. So high blood pressure, cholesterol, sugar, obesity, all these heart problems, they predispose to having dementia, brain problems, forgetfulness in old age, and sometimes not even in old age. So those are essentially the things that we must consider when we consider dementia. So we must understand what we need to do if we want to grow old and not have dementia. There are things that we can be active about that will prevent dementia in us in our later years. What do we need to do? We need to stimulate our brain. Stimulating mental activity needs to come up. The first thing is, what about our physical health? Whatever is good for our body is good for our brain. So we need to make sure that physically we are fit. We need to eat right, make sure we diet right, make sure that our exercises are right. We need to engage in exercises. It's said that regular exercises, regular walking, about 30 minutes, 3 times in a week, it gives us like 4 years of good memory. So if you engage in a year of regular walking 3 times a week, 30 minutes, you will gain 4 years of good memory. That's how relevant exercise is to our mental health. And then, how do we use our brain? One of the things we need to avoid is too much stress. Too much stress is not good for us. You pile on stress, on stress, on stress. Over time, it has inflammatory effects on the brain. So avoid stress, particularly when you're younger, particularly around this age. And then make sure that you have good sleep. I've said it before, anytime we are not sleeping well is a poison to our brain. Make sure that you have good sleep. And then he said that stimulating activities, make sure you learn new things. Each year, make sure you have a plan. Learn new languages, learn how to garden, read new books, make sure that each year you have a new hobby that you engage in and you learn. Keep learning, not the one that will stress you. That's when some people say they want to go and do PhD. No, if that is what you want, if it's going to stimulate you, please go ahead, but make sure you do new things. Learn to use your left hand, you've been using your right hand. Learn to dance, learn to listen to relaxing music, learn how to meditate, learn how to shut down the world. Learn how to be on your own and shut down the world, relax your brain, take away all this social media and phones and everything, and shut it down, and then stimulate yourself. Learn how to read, learn how to write. Make sure that you're engaged for as long as you need to be. So, why do we need to befriend August? Why do we need to know about August? Reason is in knowing about a young woman who developed dementia, because it does happen at the age of 51. It helps us to know that we are not infallible. It helps us to know that this same thing, if you are not careful, can happen to us. It also helps us knowing fully well about August. This dementia is all around us. So it's going to create our awareness, and then we can advocate for it. We know how to take care of people or how to impact them positively, those that have it around us. For me as a person, not even maybe so much as a doctor, I once had a patient. That was the first time I knew we must get to talk about this issue. And recently I had reason to remember the patient. I had seen the patient about 8 years ago, and the man was about 54 years old. He once had stroke and he had memory problems, but he resolved, he got better. Then he traveled to the US again because he used to live in the US, the family here in Nigeria. And then there, he didn't take care of himself again. He stopped using his BP drugs and he had another stroke. And that was the end. He had dementia. And we were taking care of him. He had a lot of behavioral problems. He was always aggressive, always beating the wife up, always very difficult to manage. And then one day, the family, the wife saw me and said, Doctor, is there going to be an end to this problem? And then I was giving all these doctor replies and trying to evade and saying, all these clinical terms. And she said, Doctor, hold on. My father in law had the same problem when he was 90 something. I can't remember. Well, he was 90 and above. And I took care of him for 3 years before he died. And, doctor, that 3 years to me was like 30 years. Now my husband is just 54 and he has the same illness. Doctor, how many years will I have to bear this? The pain, the burden of dementia, nobody, nobody is strong enough to bear it. We must do all that we can do to avoid it in ourselves, in our family, everything. We must do it because the burden is really, really, really huge.
Hello, hello, hello. You are welcome. Uh, yeah. You are welcome here, everyone. Though we haven't got anyone here yet, but it's a lovely weather. Let me see what's happening with my mic. Yes, it's a lovely weather, and we are live on Dr. Bumi Abel TV. So we have a lovely guest with us today. And for some reason, my screen is freezing. Can you all hear me? Can you hear me? Don't know why my screen is freezing. Okay, can you hear me? All right, good. So we are live talking about dealing with stress. And one of the ways I have decided to deal with my own weekend stress is to just lay out in the garden, enjoy the lovely sunshine, because we don't have this all the time here in the UK. So it's nice to, I don't know if it's vitamin D now because it's already 2 o'clock, but whatever name it is, I know I'm having a swell time in the garden. So hope you are somewhere nice. Hope you are enjoying the weather wherever you are. This is Bumi Abel TV. Thank you very much for joining. Thank you for always supporting. Thank you for always coming around to share on. And today, without further ado, we will get on with the program. I'll invite on the screen. For some reason, my screen looks frozen. Is my screen frozen? Does it look like my screen is frozen? Let's see. Yeah, well done. Thank you very much. Speaking Grace, you are welcome. Thank you very much for being there. Yes. Thank you very much for coming on on this show today. It's about relieving stress. So how do we relieve stress? We know sometimes in our daily walk, in our daily career, vocation, or whatever it is we do, we tend to find a lot of stress. And there's so many things that have been happening over the past few months where we just hear of people just dropping dead, and we begin to wonder what happens to them. Were they stressed out or what? Yeah, it's lovely. It's a lovely sunny day. Thank you very much, Speaking Grace. Thank you for joining. So, without further ado, we are going to invite on our show today a very lovely sister. She is a doctor. I will put on there what, let me, 1 minute. So she is a doctor by profession, and she's here to actually talk to us about how she relieves stress, how to deal with stress, because we all face stress at one point or the other in our lives. So either you're in the ministry, or you're doing YouTube channels, or you're you have a vocation, or you have a calling or career or profession, whatever it is. We are here to learn from someone who who knows what she's talking about. And so our guest today is Dr. Eitayo Adumo, and she's a consultant family physician. She's also a business coach, a lover of God, and married with kids. So I'll invite her on the screen today. Yes, you are welcome. Thank you
Thank
very
you
much.
very much.
Thank
I'm
you.
so happy and so glad to be here today and
Thank
to
you.
connect with each and every one of you. Good morning, good afternoon, good evening, wherever you can hear me from and whatever time you are hearing me from. I am Eitayo Adumo. I'm a consultant family physician, and the journey for being in the medical school started about 19 years ago. And it was at that point in time, I just made a decision that I wanted to go into it. Why? Because I love going and working, helping people to see that they are better. And I love seeing people getting sick. So that was one of the reasons why I actually went into the medical profession at that time. And it has been a wonderful journey from going from that stage. Later, after I finished, to now become professional, to go to study more, I looked at so many fields because there are so many fields in medicine. And the reason why I chose to be a consultant family physician was that I actually wanted to help families. I wanted to help and connect with families. So that made me actually to go into that profession to learn how do I connect with families and help everyone in the family, right from the father, the mother, the kids, the elderly ones, everyone around in that particular family. how do I help them? That was what
Mm.
made me to go into the profession of being a consultant family physician. And
Wow.
not only that, the journey of those 19 years has actually been stressful because we also experience stress every day, every time. And thank God we've been able to manage the stress wave we encountered in one way or the other. Because even while I was still in school, I was still able to, do other curricular activities and also move or fellowship with God and all that. So it was really a wonderful time spending that time and then being able to manage the stress at that point in time and throughout all the journey. When I started to become a consultant family physician, it was stressful along the line because I was having kids to take care of with
Mm.
my husband. Sometimes I'll be at work from morning till evening. You understand the way it is. So it was really a stressful thing managing those times. But through that, we've been able to learn how to manage and deal and manage your time to see that at the end of the day, we still come out good and fine so that the stress does not overcome us. Let me use that word. But we are able to manage it and we are able to still keep healthy and fit.
Wow. Wow. Thank you. Thank you very much. That's so nice to see that you have been in it. It's not like something you're just quoting out of a textbook. You have
Yes.
been in it. You're a family person yourself and you know what the kind of stress, the different kinds of stress people
Yes.
could be going through in life. And you are a medical person, so you know what it means. So you know what you're
Yes.
talking about. I'm glad you're here today and you're able to find time. Thank you to those who are coming on Facebook, who are on YouTube, who are here. You might see, I just want to let out the sweat because we don't have this kind of weather every day. So in the UK, I'm trying to, I don't know if it's tanning myself, I should say, whatever it is, but I'm glad that you are here joining us. And thank you to Speaking Grace TV for joining us. Please write your comments down below, subscribe, like, and do whatever it is you need to do, and even share with other people so that so many people who are going through all of these things we're going to be talking about today can also learn. The essence of doing this is not to keep it to ourselves, is to care for other people and let them understand what they need to do when the signs are there, what they need to do to take a back seat or whatever it is our guest will be telling us today. So I would like to ask, what is stress? What are the different types of stress and how can it affect individuals in their career?
Thank you very much. Stress, majorly, let me use the simple definition, is the body's response to changes in our life. In life generally, change is a constant thing. We change from day to day, from time to time, and changes occur in different and diverse places. So stress is just a response to those changes that occur. And then sometimes it may be a normal part of life in which it can help you to grow and learn. Not only that, it's also a natural feeling of not being able to cope with specific demands or events happening in your life at that point in time. So stress most times is something that can be good, let me use the word, and it can be bad. It can be good in the sense that it can help you to grow and learn and help you to, know some things and help you to be able to know how to manage yourself. But it may also be in the opposite direction, in which it may cause significant problems to you if you don't know how best to manage it. Now, the different types of stress that we have acute and chronic stress. Acute stress happens day in, day out. These are short-term stress, and they are the most common form of stress that we know. Most times it's something that comes, you just face it for a little time. Take, for example, in your workplace, you have a project to meet at a particular time. You may be stressed because of that project and because you wanted to meet up with maybe the submission time of that project. So that may be an acute stress that you face. Then, apart from that, you can have other things that may give you acute stress, like maybe an event occurred and then it affected you badly. That may just be an acute stress that you're facing. The other second type of stress that we have is chronic stress. For chronic stress, most times it's over a long period of time. It's not something that's just happening acutely. And most times it may be harmful to you at the end of the day because it would affect your health, it will affect the way we relate with others, It will affect everything about you. So the best thing is to deal with acute stress so that it does not become chronic stress, because from acute, it can become chronic. If you're having it repeatedly and it's occurring all the time, it's better you handle it. Now, how can it affect individuals in their career? The truth is, it can affect you in your career, because for acute stress, most times it may be something you can still manage, but when it becomes chronic, especially for chronic stress, most times when it can happen in career is for people that maybe they get a job. It is not the job they love doing, but they just went into it because they couldn't get any other thing to do. They just wanted to make money out of it. At the end of the day, it can become stressful for you. Why? Because it is not something you are doing with all your strength and might. You're only doing it because you needed something to just come in for you, as in terms of money. Another thing is that if you are someone that also you are busy, or you have a bad leadership, maybe a bad boss, a boss that's always nagging or keep putting you in trouble, it can be a form of chronic stress for you. Why? Because you see the person every day and you have to move with the person every day. Those are ways in which you can affect every individual in their different parts of life. So you can actually have acute and chronic also in your workplace. Chronic stress can also come in also when you also meet with people that are very toxic, maybe co-workers that are not cooperative, hard to relate with. Or you are given a duty at work to do, and you discover that you find it very difficult. Maybe it's not your role, or you were given extra role to perform, maybe because of lack of manpower or something, which can put you or make you to become stressful at the end of the day. Thank you.
True. Thank you very much. It's good to know that there are good sides to stress and there are bad sides to stress. What we want to do is to harness the good part of it and make sure we use it for our benefit, like increasing productivity. And sometimes I tell some people, I say, I think I perform better under stress. When I know that there's a deadline, I kind of, all the adrenaline kicks in. That's the good part. But then you don't want to do that every day, do you? So we don't want to do that every day. Well, thank you very much. I was looking at some statistics. I don't think it will fit in the screen. Yes. But let me divide it into two. So it says, according to a survey carried out in the UK in 2020, the most common type of stress experienced by Brits was work stress. And with 9% of respondents saying they frequently felt this type of stress. Now, furthermore, 60% of respondents frequently feel monetary stress, while 48% experienced family stress. So stress is not just work or career based, it's in every aspect of life. So that leads me to a question that I'll be asking. For those who are on Facebook, we will be going, let me see. For those who are on Facebook, we will be going off Facebook for now. Please join us on YouTube. We'll be going off Facebook because we want everyone to just be able to watch it on YouTube. So I will be removing Facebook, this Facebook link. So yeah, you haven't missed anything. Just go on YouTube. The link is there. Just try to go on YouTube. All right. Thank you very much. And we continue with that. So yes, save changes. Now, what are the signs that show a person is stressed, either in their career or workplace, or they're having financial stress or family stress or whatever kind of stress? What are those signs we need to watch out for?
Thank you very much. Before I go into the signs we want to see, the statistics you just brought out now, I remember that I also read and I discovered that generally the stress people feel more is work stress. From statistics in different places. I read that of the American Psychology Association. I read that of the UK too. I saw that of Nigeria too. Generally, people face work stress and monetary stress more than any other form of stress put together. So those are key things that we need to look into so that it doesn't affect us negatively in any area. Okay, so the signs and symptoms you can have when it comes to stress, especially when it comes to work stress, are things like headaches. Headaches are common things you can have as a result of work stress. And Most times it's described as tension headache. That means you feel as if something is round your head. So you just be feeling the headache round the head. So headaches are common things. Muscle aches are also very common. Aches in any part of the body can be found. And then another thing that can occur for work stress, if it's short term, it's better, but long term, it's not so good when it comes to not being able to sleep. So sleeplessness, in which you are not able to sleep at any point in time, if it's over a long period of time, is not so good for the health. God knowingly put sleep there to help us to break and reduce stress, because it's part of reducing stress. So, but when you're not able to sleep, it actually makes you feel more stressful. And then another thing is that work stress, one of the things that work can cause, or signs that you are stressed, it may be that you discover that you are becoming more obese. Why? Because you sit more, you're not, you do more of a sedentary lifestyle thing. And so you think you tend to gain more weight as a result of stress. The last thing I want to mention is burnout. And burnout is the highest form of stress, in which the person feels as this everything is meaningless, and they disconnect between what they are doing and the current thing they are doing. They are disconnected from it. Why? Because they are burnt out. And so many things can cause burnout. All the things we have mentioned before are the things that can cause burnout. When stress gets to the highest peak is what we call burnout. So other things we can see as signs are anxiety too. You just feel that you are anxious, and then you are fearful over things that are not need, you don't need to be fearful of. Other things that you feel fatigue, you feel weak, you are not able to concentrate with the work you are doing. And then some people even find it unable, they withdraw from other people. So there may be social withdraw from other people around them, which are signs that are not too good when someone starts withdrawing from people around. And not only that, they become aggressive with everyone in the workplace, which are not too good and may affect their relationship with people around them. So those are possible signs we can see. Another thing people go into there is that they may start taking drugs or alcohol when they have become stressed. Or some people even lose their drive for sex naturally because of the stressful condition in which they find themselves. Okay, thank you.
Wow. Thank you very much. Thank you very much. So it affects every aspect of life, from the crown of our heads to the sole of our feet. It affects us, and even not just us, but people around us when we are stressed. So, like we said, let us harness the good parts of stress and do away with the other part. Speaking Grace says, very profound discussion. Thank you very much, Speaking Grace. Yes. Please write your comments in the comment section. Remember to do what you have to do, like, share, subscribe, and all of that. Thank you very much, Dr. Adumo, for throwing more light on that. Now, the next question is, how do you prevent a situation from getting too stressful to manage? You've said, oh, one of the signs is headache. Some people become shouty, shouting at their spouse or parent, or children or people around them. They begin to break relationships. There's so many, they become aggressive. When you're stressed, you become burnout, you have no energy, and so many other things you've said. Now, how do we prevent a situation from getting too stressful to manage? What can you do when you are stressed?
Thank you very much. Things we can do that we can use to prevent stress. I have like 6 things listed out that I want us to take note of that we can do that can help us to prevent stressful conditions. Number 1 is that you must work with purpose. That means you will look at what you are doing, the impact of what you are doing on others. That means, how is it impacting people? Oh, I'm doing this because I want to make things better for other people. Oh, I'm doing this because of this. So work with purpose. Know the reason why you are doing what you are doing. That would help you to prevent you from being able to manage the stress in which you are going to get to. Not only that, you must take control. That's the second thing. Take control of the situation. So how do you take control? You can have a to-do list. These and these and these are what I want to do today. Having a to-do list helps you to at least be able to manage yourself well throughout the day. So you take control of the situation. The third thing you need to do is that you must rationalize your workload. What do I mean by this? It means there are times you need to delegate responsibility to others, so delegate. There are times you may have to eliminate some things that will cause stress, then eliminate them. That means remove them from the way so that they won't make you stressful. When you need to allow others do it, let them do it. So it's always better. Doing this helps you to be able to, take control and prevent stress from coming your way. The fourth thing is regular exercise. Exercise does not mean until you go out and do things. Even in your house, you can do exercise. You can wake up in the morning and jump up 100 times. I do it myself. That way, it helps me to be able to keep my day going. So exercise can be in different forms. So regular exercise helps you to keep fit and helps you to be agile and be able to walk and reduce any form of stress. The fifth thing is that you must learn to manage your stress. That's the way to prevent it. Learning to manage that stress will help you to prevent you from getting into stressful situations that would be negative or impact you in any way. The sixth thing is that you must be willing to give to others. That means even when you're in your busy schedule, deciding to help somebody else, in a way, it gives you joy and makes you feel fulfilled, and so helps you to be able to relieve stress. So give to others, help others, do something or the other for the other person, and thereby you prevent yourself from getting into any form of stressful situation. Thank you.
That's true. Thank you. Thank you very much. So getting into a stressful situation is not what we want as parents, as workers, as children, as whatever it is we are, whatever position we are, mothers, fathers. So learning about this is actually an eye-opener for me as well. Thank you very much for showing us that. There's a question here. I've got someone, Tolu Alunga, saying very relevant topic. Thank you. Speaking Grace saying, I have shared. Thank you very much for sharing. Thank you, because we all need to hear this. As long as we have blood going in our veins, we are prone to stress. And there's a question from TW saying, do teenagers go through stress, and from what age?
Hello.
Yes. Did you hear that?
Yes, I had. Everybody goes through stress. Children and themselves can become stressful. Take, for example, children in which they're maybe foster mothers or stepmothers, maybe not their real mother, and the person is maltreating them. The child himself can become stressful and starts, finding it difficult to sleep, or finding it difficult to cope in class or in the environment they find themselves. Teenagers too can become stressful from any age. Like I said, children. So it can go from children to teenagers. Teenagers can become stressful, and this can happen from any age whatsoever. Take, for example, maybe in their school, if they are faced with one situation or the other and they don't know what to do, it can be a source of stress for the person. Take, for example, one of the subjects they are teaching in school, he doesn't understand and is not able to see anybody to relate with or to connect with or to share this with, to be able to, relieve that stress or be able to find a solution for that problem. Teenagers that are not able to do that can actually become stressful. So everybody can undergo stress no matter the age.
What is happening?
I hope you can hear me.
Yes. The internet is playing up like
Yes.
we thank God that we're still able to connect. Now, thank you very much. So you said it
Hello?
doesn't matter. Even children that are not teenagers can have a way of buffering that. I think that's why children in exams, they're doing exams. Can you hear me?
Yes, I can hear you.
Okay, good. So I said, yeah, children from the time they start writing exams and maybe going on social media and feeling peer pressure, that could stress them out as well. So I don't think it's age dependent. Anybody, as long as you have blood flowing in your veins, can face stress. I don't know about babies, so.
I don't think so.
I'm not an expert. I don't know about those. But yeah, the next. Okay. So the next question I would like to ask, there are no questions on the platform, is what advice would you give to calm down a colleague who is stressed out about a deadline? What advice would you give? What would you expect us to, being our brothers or sisters keeper? How can we help others? You know, it's not all the time we face stress. We might see someone who is actually suffering from stress and we're like, oh, how can I help this person? What are your advice? What would be your advice?
Okay, thank you very much, ma'am. My advice for such a person, number one, you first identify the stressor, or which at that point in time is that you want to, get a deadline. At that point in time, if you discover that it's too stressful for you, you can decide to get support from co-workers. Take, for example, you have to do some things and it's taking your energy, taking your time, and you don't even know how to go about it. Support from co-workers may be one of the things you can do in order to be able to meet the deadline. So talk to co-workers around you and say,
Internet.
oh, please, can you help me with it? Can you hear me? I hope you can hear me.
Yes, I can. Yes, I can hear you. Oops, what's happening? Okay, viewers, if you're
To
still
get
here,
support from co-workers. Another thing you
I'm trying to let me
okay,
take
I think
myself.
I'm back. Network was bad, sorry. So one of the things you can do is that you can also organize and prioritize the work you want to do so that it may make it easier for you. So you can maybe take, for example, leave earlier for work, and then you can break the work you want to do into smaller bits for you to make it easier for you to be able to handle. Not only that, necessary, like I said, sleep is always a very good thing. So when you see that you even have a deadline to meet, it's not for you not to sleep at all. Please still take time to have at least some hours of rest. Why? Because when you rest, it helps you to be refreshed, it helps you to be able to cope, and you are able to do and undo difficult tasks. And the last thing is that you may also, like I said, delegate responsibilities to others, which they may be able to do in order for you to be able to meet the deadline in which you are after. Thank you.
Okay, great. Thank you very much. Yes, so being our sister's keeper, being our colleague's keeper, being there to help others, we derive joy even when we help other people. So, yeah,
Seems
thank
you
you
are
very
muted.
much. Am I? No, I'm not.
Can't hear you.
Oh, you can't hear me. Okay. Can you hear me now? Can you hear me now? Okay, can you hear me now? Can you hear me? Okay, we have another question saying, okay.
I can't hear you at all.
All right, someone can hear me. So question on the...
Okay. What are the effects of stress? Okay. So the effects of stress on the body, it can affect every aspect, like we said. It can affect your health. And what will you do with your health? It may make you to become depressed or to become anxious. And when you're anxious or you are depressed, you find it difficult to be able to cope with your day-to-day activities. And therefore, it will reduce your productivity at work. So at the end of the day, you are not able to do what you are supposed to do normally. You are not able to meet demands. And the last thing is that it affects your overall well-being. So it can bring other things onto your life. Take, for example, your relationship with your family, your friends, and the likes may also be affected. So for the health issues, you can start having things like high blood pressure, which was not there before. You can start having things like insulin resistance, which now at the end of the day leads to diabetes. You can start having high cholesterol. So those are possible things that can, that can happen when you are stressed out. Thank you.
Thank you. That means stress is more like a magnet that attracts things, you don't want. It's like a magnet. So you want to eliminate that magnet from attracting other diseases. Can you hear me, my sister? Can you hear me, Dr. Adumo? Can you hear me? Okay, if you can't hear me, don't worry. Others can hear me, but I will post the question on here. Okay, so.
Okay, so yes, I am a Christian and I believe in God, and your belief or your faith can actually help you to overcome stress. How will this help it? Anytime you are faced with stress, having time.
Okay, if you're still here,
with God has a way of, for example, casting your cares on God will help you to be able to relieve some stress. So when you are worried about something, say, for example, you have monetary stress, maybe you don't have enough at that point in time, just put it upon God. And in a way, it helps you to have that relief and see that you can share what you're passing through with someone that's able to help you. So I feel that actually helps us to be able to overcome the stress we are going through. When we are faced with a situation at workplace and we don't know what to do, and it's telling on our health, we can easily take it to God and it will see that the solution or the way to go about it will just be shown unto us. So our faith actually can help us to overcome stress. Our belief in God, our trust in Him can help us to overcome any stress we are passing through.
Thank you. Thank you. That reminds me of a song. It says, what a friend we have in Jesus, all our sins and griefs to bear. What a privilege to carry all our griefs to God in prayer. Oh, what peace we often forfeit. Oh, what pain we often bear. All because we do not carry all our needs to God in prayer. So it's I think faith is a very wonderful vehicle we need, and it keeps our hopes alive. So I just wonder how some people who have no faith do it. How do they go through this troublesome world? How do they go through it? It will end up breaking. So stress can either make you or break you. And so we know of what happens in the mental institutions when it crosses a boundary. It goes, when the headache crosses a boundary from headache to migraine to whatever, it begins to turn the head. So we don't want to go through that as children of God. So let's always remember your faith can help you overcome stress. Can you hear me now? Okay, she can't hear me yet.
Hear.
Okay. Okay. I will put the next question on there. So what is your favorite verse or Bible?
So, my favorite Bible quotes or Bible verse, actually, I have a Bible verse that I love. I have a Bible verse that I love so much, and that is Psalm 16, verse 11, that says, lines are falling towards in pleasant places. Yeah, I have a goodly heritage. I love that scripture very much. Why? Because it usually gives me encouragement that things will continue to fall into pleasant places for me, and I'll continue to have a good heritage with God. So that's my favorite Bible verse that I love.
Okay, 1 minute before you go on, before you go further, let me ask people, what are your own ways of dealing with stress? What the viewers' ways of dealing with stress? Dealing with stress. Write in the comments down below. Yeah. So what are the viewers' way of dealing with stress? Write in the comment down below. Yeah. So I'm asking the viewers, what are the ways of dealing with stress? We can learn from ourselves. Maybe there's some points that I've mentioned here that you think, oh, this is what I do. Please share with us. Let us learn from you as well. And
okay, ways of dealing with stress, Abby?
Yes, for the viewers.
So yes, for everyone watching us, thank you very much. And I believe that for every one of us, ways we can deal with stress, there are so many. One of the things is that you can find whatever you love doing, your hobby, maybe something you can go to do anytime you're stressed. Another thing is that you can decide to have a bath, a hot massage or something. It will help you to relieve stress. Like we have said, having faith in God. So you can decide to go for fellowship and fellowship with other believers. That can also help you to relieve stress. Not only that, you can decide to listen to a music. It would really help to relieve stress. Another thing you can do is that you can decide to cook maybe the meal you love or take something that you love to do. It may help you to relieve stress. You can decide to watch a movie or something you love doing that would stir you up and help you to be able to relieve that stress. You can decide to read a book. You can decide to go for a walk or take a ride, go for hiking. All those things are things that you can do that can help you to relieve stress. You can decide to call a friend or family for support if you need any support in any way from them. You can also make a list of things that will make you happy or will make you feel happy when it happens. So doing things like these are things that you can use to deal with any stressful condition you have. Another thing you can do is you can have a journal and start writing things or thoughts of things that would really help or inspire you. So these are ways and many more that you can use to relieve stress whenever you're faced with it.
Thank you very much. I can see someone says, what I do is I start out by praying, identify what's the cause, and seeking help. Yes, seeking help. That's something most people don't do. We feel, oh, I should be able to handle it. I'll handle it. Especially, I don't want to say the gender, but be like, oh, yes, I can do it. I can do it on my own. Yeah, I don't need help. People have done it before, da, da, da. But seeking help is a very good step as well. Thank you very much. So we praying about everything and anything, identifying what the cause is and seeking help. Thank you very much, Tolu Alonge, for sharing that. Thank you, Pastor Tolu. Anyone else has any way of dealing with stress? Like I am in the garden today. I'm thinking, why stick myself indoors? Just come out and relax in the garden. Get the vitamin K or whatever it is. Not the D anymore because this is afternoon already. Anyways, so thank you very much for coming on the program, Dr. Dumo, on the program. I have to type it out because you can't hear me. Yeah. So, thank you very much for coming on the program.
Thank you very much.
Reach you for further questions. I hope I haven't lost you there. Yeah. Yep. Let me. Okay, she's gone. All right. So thank you very much, viewers, for coming on the program. I hope she will be able to give us a roundup of the whole thing. I am so grateful that you were able to make it on here, and I really appreciate you coming on. Can you hear me now?
Yes, I can hear. Sorry, it was network.
I should have actually asked you to go out and come back in. Maybe that would have helped all this while. But yeah, thank you very much for coming on the program. Thank you for your time.
Okay,
I know you're a very busy person with ministry, with family, everything. But you had the time to come here to bless lives. I pray the Lord will bless you in return and you will not lose your reward. The Lord will take care of all your cares and you will look back on this and glad that you blessed lives. So please tell us, how can viewers reach you for further questions?
Yes, you can actually reach me through my Facebook channel, Eitayo Olorunfemi Adumo. Or you can also connect with me maybe she can easily give you my number to also connect with me. I'm always open to ask to your questions and to your concerns anytime you need it.
Thank you. Thank you very much. Thank you very much for coming. I really appreciate your time. And so thank you very much, viewers, for being interactive, for asking questions, commenting about how you deal with stress. I think there is, thank you. Thank you to Speaking Grace TV. Thank you to Tayo Wusu. TW, Tayo Wusu. Thank you very much to Tolu Alonga, TA. Thank you, Dr. Adimo. You are blessed. And God bless you all. Please, let's share the video. Let's send it to people who were not here. And if you've got any questions, I will definitely send it off to her to help answer. Thank you. I enjoyed the session. God bless you, ma. Thank you to my sister. My sisters. Thank you very much, Sister Tolu Alonge. Thank you very much. Okay, Sister Tolu Alonge saying thank you, Dr. Adumo. Thank you for your time. Yes, thank you. God bless you and enjoy a lovely weather wherever you are, morning, afternoon, and evening. And God bless you. Take care. Bye.
Bye-bye.
Bye-bye. Yeah, thank you very much. So remember to like, to share, to subscribe, and do whatever you have to do with this video to bless a life. God bless you and see you for another interesting one next time. Bye. Cheerio. Yeah, thank you very much. Yeah, it was a great session. Thank you. Bye. Hello, and hello again, everyone. You are welcome to this channel where we talk about life, we talk about career, we talk about anything in between, just to bring awareness to us. And guess what? This month, this year, we have the mental health week this year, and this week actually, and it's all about loneliness. So creating the awareness for mental health. The theme all around the world internationally is loneliness, and I've got a very well informed speaker, a speaker who is going to be telling us about mental health. We have questions. We might know people who need to listen to this. This is a time to share this video with them so we can all learn together. So, but before I bring up my guest, I would like to share a short clip with you, and that is on mental health for this year. So this year's theme, like we all know, or maybe you don't, but this year's theme is loneliness. What is loneliness? Why do we have to talk about loneliness? Especially knowing that we've just come out of COVID, and that was a very not too pretty thing to be in. So I will share this video with us and let's learn together. Let's just see what it is for 2022.
Any one of us can feel lonely, anytime, anywhere. We can be surrounded by people and still feel lonely. Some of us are more at risk than others, but research has shown that millions of us feel lonely some or all of the time. And long-term loneliness can make us feel anxious or depressed and have a serious effect on our mental health. Yet while millions of us experience feelings of loneliness, we can still find it hard to talk about. 1 in 5 of us hide our feelings of loneliness from others. It can be hard, but there are things we can do for ourselves and for others. Acknowledging we've all been there is a start. And by coming together, we can tackle loneliness. We can also help influence policy, support each other, and help prevent mental health problems. This Mental Health Awareness Week, we want to let everyone living with loneliness know that their mental health matters. And together, we can make change happen.
Okay, so that is about mental illness for this year. And I have with me a very well-informed guest. I'll share his profile with us first so we know what he does, so that when he's talking to us, we will know that, whoa, this person is actually well loaded. So this is his page, and he talks about, is a mental health advocate. He's an initiator of so many businesses that help deal with mental health, like massage, beauty therapy, name it. He's going to tell us more about it. So this is a well-loaded person who will be talking to us today. So please get your ears open and let us invite to the screen Mr. Can you give it rolling now? Mr. Come on, Mr. Sheun Dosumu, and here he is on the screen. You are welcome.
Thank you for having me. Good evening, all over the world, anyone watching. I greet you. I thank you for offering this huge platform to discuss vital issues, especially when it comes to loneliness. I think it's a very important topic that we should talk about, because many people don't like to associate or admit that I feel lonely, or I felt lonely at some point. So I think it's an important topic. Thank you for having me.
Thank you very much. So could you introduce yourself properly, because I know I've just hit the tip of the iceberg for you about who you are and what you do. So please, the stage is yours.
Okay. Again, my name is Sheun Dosumu, and I am a mental health advocate. I run a foundation named Across All Initiative for mental health and stigma eradication. I have been privileged to drive several mental health awareness campaigns, including care and support for mental health. I also have led, Save a Life, which is a suicide prevention campaign that we started last year. And I'm a host, for many dialogues, and one of it is the care conversations. I also convene, an annual event type work and emotional balance conference, which we use to drive conversations on mental health, and then most importantly, engage key stakeholders when it comes to putting together policies for mental health.
Wow, that's a lot. That's a lot for one person. Well done. So I'm sure we're in safe hands. Thank you very much. Now, could you tell us what exactly is loneliness? How does it affect us? What, why, how loneliness? Thank you.
Okay, so loneliness, like it's been said, it could stem from a sad feeling, or just you feeling isolated from a crowd or even a multitude. Oftentimes, we as adults, we've had experiences, or we have ongoing issues that we deal with, and if we don't find solace or find a support system to help us, find solutions to some of our issues, we tend to take a few steps back, withdraw from the everyday life, go to work, have discussions with friends, hang out, and it kind of affects how we feel and think. So we decide to say, what, let me take my time, let me take time off, let me just sleep all day, be in the room all day, and that's really what it's about. Unfortunately, I believe the more we talk about it, we would expand, the causes, the triggers for loneliness, and how we can address it in the long run. But basically, it's just more like a feeling of being isolated from everyone.
Yeah, thank you. From the video from the clip we just watched, it says you could actually be lonely in a crowd. How does that?
Exactly.
What does that mean? You have people around you, but you're still lonely. I thought loneliness is when you're like on an island or just alone on your own, living alone. Do you want to throw more
Mm.
light? What exactly is loneliness to us in our world today? Can
So,
children be lonely?
so
Can adults be lonely? Is it just for the adults? Is it for the children? What to you?
this is inclusive of every gender,
Mm.
every age group. Anyone can, feel lonely. And when I hear, oh, I'm lonely in the midst of a multitude, it just tells me that we're not on the same wavelength at the time you're feeling that way. Because sometimes you are amongst, friends, and what they're talking about, their drive, is not what excites you at the moment. For some people, it could just be, the loss of a close relative, and then, all of the discussions around you just don't sound right any longer because of what you're feeling at the moment. So it's very possible, to feel lonely even when you have a crowd. And I believe it's when you're not on the same wavelength that you kind of, feel that way. But if you have a support system where you're all talking about similar things, or individuals who express a level of comprehension when it comes to how you feel or what you're experiencing at the moment, then there's a high chance that you will not feel lonely. But many times, it's always as a result of finding yourself in a network of individuals who don't have a grasp of what you're feeling, or they are totally experiencing something different. And then you're like, it seems like I'm just here. I can't really connect with anyone here. Or maybe you say, let's go for a drink. And you're like, at this point, I'm tired. I don't feel excited about anything. But these guys are saying, let's go for a drink. It's a total, there's a clear difference from what they want and what you want.
Yeah.
So, cases like that, make people feel lonely.
Okay. There's something I was looking at. It says one thing somebody's experience. It says one thing I've learned is the difference between feeling alone and feeling lonely, and how you can feel lonely in a crowd full of people, but quite peaceful and content when alone. So, what's the difference between feeling alone and feeling lonely?
So I would say feeling alone could, that could arise by, you being the only person in a class, for instance, a classroom where you usually have like 3, 5 of your friends around, and then one morning, 4 of them or 5 of them are not in class. This time around, you may have to compel yourself to initiate conversations with people, with other classmates who aren't your friends, so to say. So in that case, you can feel alone. I do believe that you can feel alone that way. But again, feeling lonely could 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 be slightly different, especially when it comes to um, dealing with issues. For instance, a mental health challenge, um, just ending a relationship, like they say in Nigeria, you have been served breakfast. So, and being served breakfast here is, ending a relationship some way in an unpleasant way. So, imagine you, in 6 months ago, you were in a relationship and all of your friends were envious of your relationship because of how you talk about it every day on your social media pages, how you talk about it, even when you are seated. But 6 months down the line, you are single and not in a relationship. So it means you don't have anyone to confide in, you don't have anyone to share your special moments with, and you are nursing you're nursing a breakup that you probably didn't want to happen, even in your wildest dream. So you can feel lonely after enjoying such a romantic and pleasant relationship. For some people it's about, like I said, loss of a relative, or you lose a job, or you are transferred from one place, one state to another state, or even you relocating from a country that you have, or a state that you have been so used to,
Yeah.
then moving to another state. So this is the literal meaning of feeling lonely. And I think as adults, even as children, they realize that at some point they have to move from being a baby, being cuddled all the time, being kicked out to even when they cry. Now, at some stage in their life, they realize that you have to man up, you have to step up, or you're sent to a boarding house, to go have a brand new experience. So these experiences can make you feel lonely.
Wow.
So I think that's like the difference between feeling alone and being lonely.
Yeah, thank you. There's another place that says what causes loneliness. I know you've mentioned it, experiencing bereavement, going through a relationship breakup, retiring or losing the social contract you had at work, changing jobs, feeling isolated from your co-workers, starting at university, moving to a new area or country without family, friends, or community. Those are causes of loneliness. Is there any one of them you think you want to pinpoint, you want to stress, you want to emphasize on those points I've just mentioned that you think
Okay,
many
I
people
would
face?
say for me, the some of the causes, or let me just say, stigmatizing people, is one trigger, is one reason why many people feel lonely, or many people battle with loneliness, and that's because it is also, this is subjective, especially when you consider the environment that you're in at the moment. Some people are so lucky to find themselves around well-cultured individuals who respect, your time, who value your relationship, who appreciate those little efforts. But some people don't even enjoy, half of this. You realize that you are always constantly being ridiculed for not, performing at a certain level. You have to battle with, somebody talking down on you. Oh, after putting in your best, somebody says, you are a failure, you are lazy. And when you constantly hear this from people that you assume are your friends, or are your, fans, or your well wishers, you tend to want to take a few steps back and not spend spend quality time with such individuals. And this can, really trigger, thoughts of feeling alone, and actually battling loneliness. Because if you have to wake up every day to go to a place of work where your colleagues are, very insensitive, they are not empathetic, then it means that every day of your life, if you work 7 days a week, it means 7 days a week you are going to have to manage, toxic colleagues. So it means every chance you get to stay away from them, then you want to embrace that. And for me, I think it's more scary, because when you begin to stay away from these individuals and spend a lot of time alone, then there's a high chance that you could indulge in practices that are even more toxic for your health, for your physical health, or even your mental health, such as drug abuse, such as maybe masturbation. You get addicted to some sort of habits that are not good for you.
True. Wow. Thank you. Thank you very much for throwing more light on that. there's a question somewhere that says, how does loneliness affect mental health? I know you've mentioned a bit of it. You've mentioned some of it, how it affects us. People get withdrawn, and it's a stigma to have that. So there's a statement that says this vicious cycle can be difficult to break without the right support. But as the report also explains, opening up about loneliness can be hard. So it's like you want to open up, but then opening up causes a stigma. And if you don't open up, it's like a vicious cycle. So the personal nature of loneliness and stigma attached to it means people often suffer in silence and deny their experiences. Have you ever had such experience with other people saying that before? And how did you help them out of it?
So this requires loneliness, it varies depending on the individual. But I think when you have a deep understanding of how to interact, how to drive meaningful conversations with people, it kind of puts you in a position of an helper. So there are people who carry happy faces all around, but some people can discern that this individual is not having it all good. So for me, because I offer some level of talk therapy and then also offer massage therapy, so I've had the chance to really speak to clients, and then there are many times they confide in me, seeing that I have an understanding of what they are feeling. I have, not the regular thought pattern of how to respond to issues. Yeah. So it puts them in a better position to admit and open up to me that, this is how I feel, this is how I think about this. It's been really very hard on me. Sometimes I don't feel like talking to people. Sometimes I just feel withdrawn. And then you understand that these are individuals who are really battling, loneliness. And interestingly, some of them are in relationships, but it's either their spouse, isn't offering the kind of support they need at the time. And then it makes them, end up withdrawing. So in my line of work, and because I also talk to, I've met a couple of individuals who are battling mental health illness as well, ranging from bipolar disorder, ranging from postpartum depression. I speak to them and I realize that, one, because there's a knowledge gap on understanding what they are experiencing. You don't have a clear understanding of what bipolar disorder is. So oftentimes they are either going to ridicule their illness or trivialize their experiences. And by so doing, it makes it difficult for them to engage and interact with the people around.
Sure.
Hence, this gives them, more reasons more reasons to spend time alone, more reasons to dissociate from, a community and just spend time alone. So these are some of the reasons why people, choose to not choose, but end up battling loneliness because they have an illness they are battling with, and there are people around them, even family members that should, be support systems, don't even have, a clear comprehension of their illness. So it makes it really difficult to interact. And then you go to offices, it's the same thing. People ridicule you for your size, you're obese, they're talking down on you, cracking jokes around your size, or you fail at an exam, people are cracking jokes, making mockery of your situation. And all of this kind of puts individuals in a very tight situation, and they are left with little or no option that just lock themselves up in a room and not talk to anybody.
Okay, thank you very much. I was about asking what are the signs of mental illness, but before you answer that, we will just go and watch a video very quickly talking about um, mental illness. So please stay tuned. While we are watching the clip, please, viewers, share the video because many people need to be aware of this. Loneliness it could lead to some things that I'm sure Mr. Shondos will be talking about later. It could lead to different things that you cannot even imagine. So we're going to be talking about it, but before then, please share this video, invite people, let them join in, ask questions. We need questions. Is there any question you have in your mind you've been ruminating about for long about loneliness, mental health? Please share the questions. This is the part one. Part two will be next week. But in this part one, we want to utilize the time by laying the foundation for mental health awareness. So let's watch this clip on mental health. 1 minute. And please share the video. Make sure you're sharing because sharing is caring. So let's do ourselves and our neighbors a favor. Okay, here we go.
You can't tell how someone feels just by looking at them or what they share online. To the outside world, our lives may look perfect, even if in reality they aren't. I'm always worrying about doing well at school, and with the end of year test coming up, I'm not sure how much longer I can cope. My thoughts swarm around my head, sometimes keeping me up all night. Some days it's just all too much, and I feel like I'm lost in space. When I did badly on one of my tests, I just about kept it together until I got home. Then I broke down crying in front of my mum. She listened for a bit, and then she told me that, just like physical health, we all have mental health. It's our feelings, our thinking, our emotions, and our moods. She then said that feeling down, anger, and stress is a normal part of life, just like it's normal to feel happy, confident, and carefree sometimes. We all have positive and negative emotions that come and go based on what's happening around us. These are everyday feelings. Good mental health means experiencing negative emotions. It's not always about being happy. Mum can relate to the feelings of stress. So when Mum suggested I take a break from everything and do something I enjoy, I actually took her advice. So I made myself a hot chocolate, snuggled up in a duvet and watched a film. And you know what? Afterwards I felt so much better. You should take her own advice.
Most of us only ever share the good things. We don't like to share how we really feel. Every morning when I wake up, negative thoughts stream through my head. Getting out of bed and pretending I'm okay takes all the energy I have. As the day goes on, the negative thoughts turn from a stream into a river. The water rushes through my head so loudly it's hard to concentrate in lessons. On some days it's so bad it feels like a waterfall that's trying to pull me over the edge. Everything is so overwhelming. I didn't think my friends would understand if I told them how down I was feeling. But when Sasha opened up to me about how stressed she was feeling, I told her. I wasn't sure how to bring up how I'd been feeling, so I started by saying that I didn't feel like myself. Just her listening made me feel like she understood. She told me some things that had helped her, so I tried them too, but it didn't make much of a difference. Even when I tried to be around my friends, I felt alone. The things I used to enjoy weren't fun anymore.
I was really
Okay, so we'll pause there. We'll continue later. So I'll bring on the screen again my guest for today. So we have just been talking, if you're just tuning in, we are talking about mental health and how it affects every one of us. We all have mental health, but how do we deal with it? How do we deal with it so that it doesn't tip over to the other side? So yeah, thank you very much for staying tuned. So what are the signs that a person is suffering from mental illness due to loneliness?
Um, again, there's no one way to this, but then the symptoms vary again depending on the individual involved. But there's a research that links loneliness to depression, links loneliness to raising anxiety levels. In fact, sometimes it also says that you can begin to display some antisocial behavior, especially when you're lonely. So these are some of the signs. You can either begin to withdraw from social gatherings. You can either become addicted to some kind of activity, which could include alcohol abuse. It could include drug abuse. It could also include other forms of maybe gambling or even over exercising. Some people use all of that as coping mechanisms. And when you see individuals who begin to embrace these activities, then it's safe to say, or just assume that this individual is not having a great mental health. So if it's possible to offer talk therapy, at least for intervention purpose, then one should try that. And but if it seems like it's out of hand, then you just might offer or bring in a professional like a psychologist or a psychotherapist or even a counselor, professional counselor.
Oh, okay. You've just talked about my next question. How do we support? Because we need to be our brother's keeper, our sister's keeper. We can see some people are suffering, like we said earlier, that some people actually suffer in silence and deny their experiences. Recognizing the signs, symptoms like withdrawal, withdrawal. I can't spell that word. Okay, addiction to substances and other things to cope with like coping mechanisms. So those are the signs. Now, how do we support them? You've talked about therapy. So would you like to tell us how you have supported people? Because I know you are a therapist yourself, massager, a body. What was that again? Exercise body, is it? Yes. So I'd like you to talk about what you do and how this has improved the health of other people. And bearing in mind that some of us are not exercise bodies, what can we do in our own little way to also contribute to add value to the society by helping mental health patients?
Okay. I think this is a question everyone should listen to at this time, and then because we're going to profile solutions. I think I am also working to be a better friend, to be a better individual, and because I feel we have so much work at hand to deal with. So for me, like I said, I had to do a course on becoming a psychotherapist just to have a grasp of how we can, offer interventions for myself, maybe when I'm in need of it, or someone around me. I think this knowledge has helped me, help other people, open up on issues that are really disturbing to them, that has been on their minds for a long time, that in fact has kept them away from having friends and spending time with friends. So I feel, therapy, talk therapy, basic talk therapy can go a long way. That's if we all, acquire the knowledge, which is very important. According to Mental Health Foundation, it is also, advised that if we can begin to create support groups, if an individual can start a group. And for us, this is one area we're also hoping to, key in the near future, we are starting like a care club where we have, a crop of professionals, group of professionals from diverse industry who are battling, loneliness. We just come together, drive conversations, um, seek ways to help each other, live a more meaningful life. And I think, support systems are very essential in battling loneliness. And more importantly, I think people should, it's also advised that people should look out for activities that engage their mind. Now, for some people, it's about reading a new book. For some, it's about watching, movies. For some, it's about, having an experience of a new travel destination. So some of these things help you, stay alert and then help you manage your emotions. So I feel if people engage their minds, positively, then they can become, happier and then battle loneliness in the right way. It's also said that if people can begin to what's that? Engage in physical activities, and that's where exercise comes in. You don't have to run 10 kilometers, but trust me, sometimes when you do less than 1 kilometer walk or even run 2 kilometers with your music list, with your playlist on, it just might, flip things for you in the right way. Those negative thoughts that keep you, feeling sad and makes you feel lonely would be out of your head, at least for temporarily when out there too. So I feel engaging in physical activities is also very essential. And considering this support system, physical activities, engaging the mind, learning new things can be very essential, especially when it comes to um, battling loneliness.
Thank you. Thank you very much. Thank you very much. Are there any questions? Like I said, there will be a part 2 next week where we'll be asking the professionals themselves who deal with patients and who have clinics and will want to tell us about how to help people further. So thank you very much, Mr. Dosumu, for this time. It's a very precious time. I really appreciate it. And like I said, I will share let me share your Facebook page so that people can go to interact with you even after this session for therapy, for body massage, and all of that. And these are things that we need, like you rightly mentioned, basic therapy knowledge, creating a support group. These are all the things you're doing just to help people get their mental health.
I'm also on Instagram for anyone who wants to follow on Instagram.
And on Instagram, okay.
Yeah,
so what are your handles? IG is
OSEUNDOSUNMU. That is OSEUNDOSUNMU.
And FB
That's for Instagram.
Okay. And FB is I think it was just your name, isn't it? Okay. So I share it there. So that's the ID handle and that's the FB handle. And you can, if you need any of these things, if you're outside the country, you're based in what country?
Lagos, Nigeria.
Okay. So when you visit Nigeria, everyone you're listening, you know where to go with all the stress of the vehicles, the traffic, the sun, everything. You know where to go to get pampered and get yourself back to normal. So thank you very much once again for this time you spent with us. We really appreciate it. If we get any questions, I'm sure by next week we will treat them if you'll be available to join by then or not. It is, but thank you very much for a short notice and you still were able to make it. I really appreciate your time. Are there any last words for our viewers out there?
I believe a high number of persons are battling loneliness. I know it's tough. I know it's challenging, especially when you're putting in your best and then you are underappreciated. I know it's hard financially. You're not doing as much as you want to, but I want to encourage you to identify someone who you can talk to, at least that you're confident to share things with. Because if you bottle up all of these thoughts, it might really be overwhelming and it might, lead to other things that we don't want to. So I encourage you to go out there, speak to someone, share stuff. Don't battle loneliness all alone. It's tough, but I want to tell you there is hope. There's a bright future out there. And we love you with the therapists, with the advocates. We love you. We understand that, feeling lonely is human. More importantly, speaking about it is more human.
Thank you. Thank you very much. And there you go. You've heard it all. It is human. It is normal to have, every human being has mental health. We all deal with it in different ways. And some people have a high threshold to deal with such stress. So let's be our brother's keeper, our sister's keeper. Thank you very much, Mr. Dosumo, for what you've done today. You've actually enlightened us and given us more information. I wish you well in your endeavors. And thank you very much.
Thank you. Have a great evening. Bye.
Thank you. Bye-bye. Bye. So we will carry on with the little clip we were watching. And that's more like saying thank you very much for being here, for attending to this live stream. We have another one next week where the professionals themselves will be coming to tell us more about it. So watch this video. I'll be putting on the screen. Watch this video to continue with what we were watching before we stopped the broadcast. So while you're here, just keep watching and let's.
Really worried about Andre and not sure what to do. He was quiet and wasn't hanging out with us like he used to. So I asked our head of year for some advice. He suggested I get Andre to speak to him since his negative feelings weren't going away.
I didn't want to speak to our head of year, but I also didn't want to keep feeling so down, so I went. He said that sometimes we have overwhelming feelings that can be more intense than our everyday feelings. These feelings hang around for a long time and change the way we feel, think, and behave. They can stop us doing what we want to in life. That's what I was going through. He also said that if we're physically unwell, we let people know, we ask for help. It should be no different with mental health. Sometimes our overwhelming feelings are brought on because of things in our life. Sometimes they happen for no reason at all. After hearing this, I felt much less alone and it felt good to talk. Scientists have found exercise can help when you're feeling low, so our head of year encouraged me to sign up to the school football club, which Sasha was already in. I still have days when the river is there, but now I'm beginning to understand my mental health. I'm learning how to cope. Our head of year reminded me that my friends, family, teachers, and lots of others at school are there to help just as much as he is. I had no idea that people around me could be so understanding. And while it's not always easy to talk about my mental health, the person I'm talking to might be able to help. If you don't feel like talking, that's fine. You could try writing, sports, reading, art, music, playing with your pet, whatever makes you feel better.
If you're the person someone talks to when they're struggling, just listen with no pressure or judgments. You don't have to have the answer. If you feel unsure about anything, you can speak to a trusted adult. Talking about mental health doesn't have to be difficult. After all, it's something we all have.
Yes, exactly. Talking about mental health doesn't have to be difficult. It's something we all have. So let's be our brother's keeper. Let's engage with people. Some people might be quiet. We've heard what the symptoms are. I mean, what the signs, not symptoms, what the signs are, and we can be there for other people. So let's make it a point of duty to be there for other people. And I will end on the note of the video we have watched before. I'll do it again, and that is to say farewell, and please keep your mental health in proper shape. Let's be a support group to someone. Let's learn basic therapies and let us be there for other people. Even as we are there for ourselves, let's love ourselves enough to take that break, to take the holiday we need, we so much deserve, and balance our lives. Thank you.
Any one of us can feel lonely, anytime, anywhere. We can be surrounded by people and still feel lonely. Some of us are more at risk than others, but research has shown that millions of us feel lonely some or all of the time. And long-term loneliness can make us feel anxious or depressed and have a serious effect on our mental health. Yet while millions of us experience feelings of loneliness, we can still find it hard to talk about. 1 in 5 of us hide our feelings of loneliness from others. It can be hard, but there are things we can do for ourselves and for others. Acknowledging we've all been there is a start. And by coming together, we can tackle loneliness. We can also help influence policy, support each other, and help prevent mental health problems. This Mental Health Awareness Week, we want to let everyone living with loneliness know that their mental health matters. And together, we can make change happen.
Thank you. Together, we can make change. Hello, and hello again, everyone. You are welcome to this channel where we talk about life, we talk about career, we talk about anything in between, just to bring awareness to us. And guess what? This month, this year, we have the Mental Health Week this year, and this week actually, and it's all about loneliness. So hello. You can hear the voice behind the scene. Hello. It is nice to see you again. You are welcome to this channel where we talk about life, career, awareness, and everything in between. You are welcome. Today we are talking about grief. Yes, grief, how to manage grief. And today I have with me a guest. He's a doctor of neuropsychiatry at Aro Abeokuta in Nigeria, and he's here to educate us about grief, because at one point or the other in our different lives, we have faced it in different forms, and some have been through it and come out of it, okay, while others have actually tipped over the line, and we know we all have different thresholds for pain and grief and loss and all of these things. So he's going to be talking to us today, and without further ado, I will just bring him up on the screen. He is Dr. Adegboyega Ogunwale. You're welcome on the screen. You're welcome, sir.
Thank you.
Can you please introduce yourself?
Well, my name is Boyega Ogunwale. I'm a psychiatrist. I work at the Neuropsychiatric Hospital, Aro Abeokuta, Southwest Nigeria. And it's a pleasure to be on the platform tonight.
Thank you very much. So the first question is, what exactly is grief? It might be a big word to some people listening, or is there a medical word for it? Is it a medical word? Just what is grief?
Well, I think grief is an English word, and it's got comparable terms in different languages of the world. But beyond being an everyday word, it could also be seen as a technical word in medical practice, particularly in psychiatry. So grief can be described basically as an emotional as well as behavioral response to bereavement. And you will realize that I've introduced another word, which is bereavement. And there's a reason I do that, because grief is a reaction. And a reaction to what? Bereavement. Bereavement itself is the loss of a loved person to death. So effectively, grief is an emotional as well as a behavioral response to the loss of a loved person to death. I could argue that grief could, in a narrower sense, apply to the loss of a loved object beyond a loved person, but I wouldn't want to go into those arguments just yet. And then the last bit I think I should mention is that in addition to grief and bereavement, there is a third component, which is called mourning. So mourning is a culturally appropriate manner of demonstrating grief. So bereavement is the loss of a loved person to death. The grief is the reaction to bereavement. And mourning is a culturally sanctioned or culturally appropriate manner of demonstrating grief. I'd like to put it that way.
Oh, okay. So if I may get that definition of mourning again, you said it's a culturally appropriate manner
of demonstrating grief.
Of demonstrating grief. Because I'm writing that on the screen for people who are catching up.
I see.
Demonstrating grief. Okay, great. Thank you very much. And so is grieving actually necessary after a loss? What do you think from a doctor's perspective?
Well, I mean, to say that you want to look at it from the point of necessariness, I think it's quite an interesting perspective, because grief is a natural human response to loss. So it's not a question of whether it is necessary or sufficient or any of those philosophical, considerations. It is a natural, very natural response to loss, particularly the loss of a loved person. And then there are several stages of it. So it's not something you choose. It comes upon you. It is thrust upon you. It is cast upon you by your circumstances. So I would say that in a sense, it is necessary, but in a more profound way of looking at it, it is a natural response, which sometimes you hardly have a choice in or about. Yes.
Yeah. Okay. Thank you. Thank you very much. And so that takes me to a question of, can grief and loss actually lead to mental illness?
Okay. That direct link is not far-fetched, but may not be that direct, to put it mildly. So grief, being natural in response to loss, would normally not lead to any mental disorder. However, if there is pathological grief, then it could lead to mental disorder. And what do we mean by pathological grief? Of course, pathological means abnormal. So when grief is abnormal, it's on about 4 levels. One is an abnormal intensity of grief, which may be manifested by depressed mood or depressive features that are in excess of what you would expect in normal grief. And it could also have things related to intense anxiety beyond what you will expect in normal grief. That would be abnormally intense grief. Apart from being abnormally intense, it could be delayed. So you would expect that the first stage would have kicked in within 2 weeks. But if it is now delayed beyond 2 weeks, you would say that that sort of grief is delayed. Beyond being delayed, it could be prolonged. So you would expect that within about 6 months, the stages of grief should have all been negotiated. And after 6 months, you would have been expecting some degree of resolution. Of course, within the first year, you would expect that on the anniversary of that loss, one could have what you call an anniversary reaction. But effectively, after about 6 months of the loss, the grief should have been resolved largely. And then it could be distorted or inhibited. So I've mentioned abnormally intense, unusually prolonged, delayed. It could be distorted or inhibited. So when you don't find the normal features of grief at all, or you find abnormal features, for example, a person grieving could perhaps hear the voice of the loved person who is already dead, but it will be very transient. It will not be prolonged. But for the person to now I say that I sit with him, I eat with him, we take a stroll together, that will be distorted. And that tends to happen in those who, in the background before the loss, could have been having some psychiatric illness. It's usually in such scenarios that you have distorted grief. But by and large, those are ways in which grief can become abnormal and perhaps ultimately lead to a mental health condition. Yes.
Wow. So grief could actually become abnormal when it...
Oh, absolutely.
Wow. So from what you said, it seems there are stages. You said, well, within 2 weeks, one should have overcome it. Or if it's delayed, then maybe 6 months. And then you talked about 1 year anniversary. People should have grieved if it was distorted. Is it distorted? You said prolonged.
Yeah,
yes, the prolonged one is
prolonged.
1 year.
If it's prolonged,
yes,
it then exceeds 6 months roughly. But again, these are how would I call it? These are general timelines.
Yes,
may not apply to every human being in that very strict sense.
Yes.
But generally speaking, that's what you would expect. Yes.
So there's a question I have in mind about when people still weep. When you remember somebody and you still weep about it, maybe okay, for example, I lost my mom like how many years ago now? Maybe 12 years ago or 13 years ago. Yeah, lost, well, almost 15 now. And when I not me, but I'm just saying, in case when I remember maybe every anniversary and I'm still weeping about it and I'm still like wishing she was here and all of that, what would you class that? Does that mean I haven't grieved enough, or does that mean it's just symptoms of mental illness, or what would you classify that as?
Well, I'm sorry to hear that you've lost your mom. I haven't lost mine, so I'm sorry to hear that.
Nothing.
The truth of the matter is, no, I mean, to whatever degree human beings try to resolve their grief within the timelines that I've suggested.
Yes.
But be that as it may, there are those who do not fully resolve certain issues surrounding that loved person. So occasionally, when those unresolved issues or psychic material come up in the mind, one could respond in an unusually intense way, like crying or just feeling rather low in your mood at such periods for only a short while. And for some others, it's not that they've not resolved those issues, but that they are having what you call an anniversary reaction. Now, to a large extent, what you will find is that even when you do weep or you do express some sadness about the loss of the person several years down the line, that mood change would not be of such an intense nature as to suggest that you are in any significant distress.
Yeah.
So to an extent, one could regard that as just the mind full of memories of its own. So someone says that the human mind is full of things forgotten. It's full. So it's got memories full of things forgotten. That's paradoxical. If it's forgotten, it should not be there. But no, it's there, but it appears forgotten. And sometimes these things come up. In a more technical way, we could also think of some of these issues related to grief as what we call psychological conflicts that one had in relation to the passage of that loved person, or even issues of guilt regarding the loss of that loved person. And they may come up within the context of psychological conflict, and one would respond with a change in mood. One would respond sometimes with some defense mechanisms. For example, you could get angry 10 years down the line when you find that probably your loved person had died in a particular set of circumstances in which somebody had only recently died again. Then your anger is not so much because someone has died, but because there was an unresolved anger at the time your own loved person died 10 years ago, which you never resolved. And then the anger will come up and you're wondering, why am I so angry? And a lot of self-awareness will help to be able to process that. And then you can, move beyond it somewhat, yes.
Yes, thank you. Because you mentioned something about guilt. I know there will be situations where maybe, for example, situations where like a baby died in the car because maybe the windows were wound up, and maybe they forgot the baby, or maybe hit somebody, and so somebody died as a result of someone's action, and maybe that person is the mother or the father, or whatever. That kind of how does one grieve without always remember? I don't know. It's such a complex question to ask, to be honest, because I've never. It's how do you help such a? Well, I know we're coming to the support later, but what would you explain if that person starts? Would you say there will be delayed grief with that kind of person, or prolonged grief, or distorted grief, or inhibited grief for that kind of person who feels they're guilty for the death of a loved one?
Okay, so I would say that in the first instance, that feeling of guilt could come up even if you were not responsible for the death of that person in any direct or practical way. So in the second stage of grief, blaming other people by means of projecting your guilt or feeling guilty is a rather common phenomenon. So the guilt that I have mentioned is not as unusual as you might think it is. The reason is, being human beings and having what you call shared humanity, the people who are alive tend to feel responsible for the death of the person who has passed. They have a sense that maybe there was something they could have done to prevent the passage of the individual who is deceased. It's again a pointer to man's own view of his own invincibility. And then that continues and becomes like a guilt trip. But with a lot of support and counseling, the survivor can actually deal with that guilt feeling. So the point I'm making is the feelings of guilt when you have lost a loved person to whom you felt responsible is not so uncommon or so unfamiliar a feature. But it is also something that can be worked through with support and with counseling. But to a large extent, by the time the individual begins to confront the reality of the loss, the circumstances of the loss, going through the mourning process, spending time with the memories of the departed, eventually people are able to resolve the grief. I mean, the guilt to a large extent, yes. But some hands, they project it, they get very angry with the world around them. And you might find that within the context of abnormal grief, in which there is this abnormal intensity. And if it were to persist, then it would require some level of psychological intervention, like counseling, like medication in some cases, and in some cases, care support. Or psychotherapy.
Wow, thank you very much. So that takes me to my next question of what are actually the common symptoms of chronic grief? So those who have had a prolonged or distorted grief, what are the symptoms you see? Because if we don't know what the symptoms are, it's hard to help people or to be able to refer them to the experts like you. What are the symptoms to look out for if people are still have not overcome their grieving, if they're still having this distorted or prolonged grief?
Okay, so I think the first thing to quickly address or
Yes.
identify would be the stages of normal grief, because it will be easier to recognize the abnormal when you know the normal. So the stages of normal grief are basically three. The first stage is the stage of numbness, denial, a feeling that is unreal, that the loss is not real. And that lasts between a few hours and some days. And then the second stage would last for a few weeks to about 6 months. So about 2 weeks to about 6 months. And during that period, the person can have some difficulty with sleep, poor appetite, feelings of guilt, projection of guilt by way of blaming other people. The person can have illusions, that is, have seen things and misinterpreting what you're saying. Maybe in a dark place, you're beginning to see the figure of the person who is deceased and all of that. The person can actually have hallucinations of the voice of the deceased person speaking to him or her, or calling his name or something like that, but it's never prolonged, it's very transient. And of course, the person might be in a frame of mind in which he or she would want to sort of identify with the person who is deceased. So might want to do things the same way the person would do things, might want to keep things in the same order the person would like to keep them, might not want to have change schedules the way the deceased person would have liked to keep the schedules. And all of that, you could have that within those 2 weeks to 6 months. And thereafter, there's a resolution, a stage in which the individual now comes to terms with the loss and begins to get away from social withdrawal, begins to re-engage with social activities again, begins to engage in social organization, might now be able to put the things of the deceased away, and then begin to adjust to life without the deceased person. So these are the three stages broadly. Now, when you've got an abnormally intense grief, which might show features of a mental illness like depression or anxiety, what you would have then would be symptoms that would match a clinical disorder of depression or perhaps anxiety. So, for example, the individual might have a sad mood that is far in excess of what you would expect on account of the loss. The individual may become suicidal. So it's not a question of feeling like the world is not worth living because you've lost a loved person, but actually thinking of ways to end your own life because you've lost a loved person. That will be an abnormally intense grief and will be a red flag, a pointer that there could be some difficulty which will require some level of intervention. Of course, with the anxiety, some people might have panic attacks, and it could be far in excess of what you would expect in the first 2 weeks of the loss, which might be normal for some people in their grief. So if you now find that the panic attacks are getting more frequent and they're beginning to disable the person is not able to function socially, occupationally anymore, then you might think that there is a need to intervene at that time. Or perhaps the individual is not just hearing the voice of the deceased person, but is now hearing voices condemning him or her. You're beginning to have strange beliefs that other people find odd and are definitely not true, which we call delusions. So if you have sustained delusions, sustained hallucinations, of course, those would point to problems that would need intervention. And of course, if someone hasn't got any features of grief at all, after about 2 weeks, of the loss, then you might be thinking, oh, could this be distorted grief? Could this be as a result of the suddenness of the event and the unexpected nature of it? Could it be because the person was exceptionally close to the deceased individual, or that this person who is having distorted or inhibited grief is someone who's had some underlying psychiatric illness prior to the loss, in which case the mental illness would not allow that individual to muster the typical cognitive responses or the typical, psychological reaction to the loss. So those are the things you'll be looking at. And of course, if the mental illness seems to be getting worse because of the grief, you might need to intervene at the level of treating the mental disorder as well as dealing with the grief, if that helps.
Thank you. Thank you very much. I'm sure people listening would have would have learned from what you've just said. So many points, looking at red flags, abnormal grief, stages of grief. So you're welcome, everyone. If you're joining us, thank you very much for joining. Thank you for always being here, supporting, listening, and always sharing the video. Thank you, Joyce, Cheryl, Gospel Music. Thank you for coming online. And for the 3 people online, thank you very much. I know so many people have been coming in and going out to invite others. Thank you very much for doing that. We have with us Dr. Adegboyega Ogunwale from who is a neuropsychiatrist, call it properly. Yeah. From the is a consultant of neuropsychiatrist hospital in Aro Abeokuta. Thank you very much for finding time to join us. Now, you know, when people lose a loved one and they say, oh, don't cry, don't cry. Is that actually a good advice to tell someone who is grieving? Or say, oh, don't cry again, or just wipe your tears, don't cry, it will be well. What do you think?
You know, that practically takes us into mourning. As I said, it's culturally determined. So in some cultures, it's the way to go. You don't cry publicly. You are encouraged to hold it together. And then perhaps when you are by yourself, you can do all the crying you'd like to do. So again, it's not something that is easy to sort of judge from a very objective external point of view.
Okay.
But having said that, I think it's important to stress that it is not very helpful to encourage people to inhibit their grief responses. So let the people who are grieving express their grief within the context of what is termed the normal grief, without saying that people should become pathological in their grief. It is natural that when you've lost a loved person, you'll be pained. And in reaction to that pain, you might wish to cry. So it should not be seen as an awfully terrible thing to cry, even if you do so publicly. But if the cultural milieu is such that you shouldn't do that, I guess with time, those who are members of that culture would know how to strike the balance between inhibiting the grief and allowing the person to express the grief response. So I guess from a technical point of view, the point to be made is that you shouldn't inhibit grief. You should not encourage people to restrict themselves from expressing the physiological reactions or psychological reactions to their loss.
Yeah.
However, it can be done in a culturally acceptable manner, and those who are members of that culture will be familiar with how to get through it. I mean, to a large extent, being someone from an African descent yourself, you realize that even when we say do not cry, we don't mean don't cry. We mean just take heart. So because the fellow who is telling you not to cry is actually crying and telling you not to cry, then both people are eventually end up crying together. Yeah, so it's got a nuance to it. It's not like say you beat your grief. Even when they say you're a man, don't cry. What they mean is that there's the macho kind of facade that you're supposed to protect. But beyond that facade, when you are all by yourself amongst men, you are free to actually express yourself and cry. Yeah. So I think it's the cultural inflection that we need to get right.
Yeah, thank you. I'm sure I will get to that part where I'll be asking about how to help people grieve their loss. But before then, what are the steps to manage the grieving process? What are the steps you think people can adopt to manage a grieving process?
Thank you very much for that profound question. I guess the first thing that must be borne in mind is that grief is a natural reaction to loss, particularly loss of a loved person. To that extent, if you allow nature to take its course, you would have done well. So people should not be too eager to abort, transform, or sort of regulate the grief reaction. Because I see too many times people say, well, she's not going to be able to sleep, and therefore let us medicate her immediately, even in a in a prophylactic manner. And I'm saying no, not being able to sleep for the first few days is actually part of the natural response to the loss. So if that lack of sleep is now going to interfere with the well-being of the person in terms of having the current headaches for over the next few days, feeling very unwell, yes, you may intervene with some anti-anxiety medication, which will calm the person down and hopefully get the person some sleep. But it should not be a prophylactic response. There are those in the morning are unable who on the first day are unable to sleep, and by reason of that sleep deprivation by the next day are able to sleep without any medication. So the first point is let nature take its course. Let people grieve because it's a natural response. Now, the second point would be provide support. Support is key when people grieve. So sometimes the support could be as non-intrusive as just sitting around the person and not even saying anything, but allowing the person to see that we're here if you need us. Now, apart from that support, I think one very important element that we frequently miss is practical help. So within that support, you must provide practical help. So this person who's lost a loved person may be unable to cook, may be unable to look after an infant child. Maybe you just lost a young husband and you've got an infant of maybe a month or 2 months. That person needs practical support, practical help with that. So if there are bills to pay, if those supporting can help to settle the bills, take care of appointments that can be resolved by them externally, I think those are the practical things that should be done. They actually help the person to grieve normally and resolve grief faster. So those are the things we need to do. And of course, beyond those early interventions of support, practical help, and allowing nature to take its course, will then come things like in the first phase where there is numbness, and denial, and inability to sleep, and all of that. You might, on first phase like that, you might think of an anti-anxiety medication. And in the second phase, where it's more consistent with depressed mood, feeling tired of life, just losing interest in things, unable to sleep, unable to eat. In some cases, when it is quite profound, people use some antidepressant medication to help at that point. But of course, whether anti-anxiety or antidepressant, these decisions will be made by the experts. And it is only when people realize that the grief is getting rather intense that we would perhaps need these medications to support the individual.
Thank you. Thank you very much, Dr. Ogunwale. Thank you for those who are online joining us live. Please ask your questions. We have our expert here who is ready to answer any question at all about grieving, about mental health when it comes to grieving the loss of a loved one. So please send your questions in because we will be rounding up soon. We've done 30 minutes already and we don't want to stay here forever, but we want to get it done very quickly. So please send your questions if you have any. I know you've mentioned it in the course of the talk about how to grieve, but for the benefit of those who are maybe joining us, just joining and are asking in their minds, is there a proper way to grieve? Could you please answer that question? Is there a proper way to grieve?
But well, thank you for framing it in that way. The only problem I will have is with the word proper.
Okay.
As I said earlier on, in general, or generally speaking, grief would come as a natural response to loss, the loss of a loved person. So what is proper for one person, it would not be proper for another person.
Sure.
So in some cultures, it will be proper for you to throw yourself heavily on the ground, put your two hands on your head, raise a very terribly loud sound of anguish, and then burst into tears. That would be very proper in some instances. And in others, you just have to hold it together. You allow the tears to drop silently, quietly, and you deal with your pain without creating a scene or being too dramatic. Both would be proper in my view, depending on the circumstances and the cultural, situation. So what I think is a proper way to grieve is first, allow the individual to naturally respond to the loss in that person's own individual manner. And we're all different.
Yeah.
On your part, as a person providing support, make sure you are around that individual to help the person go through the stages. So, for example, the first stage is one of numbness. The person wouldn't know what hit him or her. And your duty will be helping the person to come to terms. Might not succeed immediately, but that will be your task. Well, my friend, my sister, my boss, please take heart. The loss of your husband, of your brother, of your child is quite painful. Or take solace in this fact that he lived a good life. What you're trying to do is to help the person to confront the reality. Because at that stage, the person has not. The person is numb. The person does not see it as real. The person is in denial. So you see all of that and you try to intervene by helping the person to realize that what is unreal is actually real. That what the individual is numb to is actually a practical pain, a true pain, which the person has to bear and resolve. And then by the time you come to the second stage, the person would be probably identifying with the deceased, would want to search for the deceased in very indirect ways, wanting to do the things the deceased person would do, having a very intense desire to be with the deceased person, might be unable to sleep. To help that sort of person grieve, I think would be to encourage the person to rest, to sleep, encourage the person to eat, and look for ways by which you can make food interesting to that person. Look for fluids, look for, the snacks that the person might want, might desire, if the person wouldn't want any other meal for that matter. And then look at ways to help the person to realize that though he or she's got a very intense desire to see the deceased is actually now gone. And one way to do that would be to ensure that the grieving person is part of the whole process of mourning, the whole process of planning maybe the funeral, being present at the funeral, having pictures of the deceased person. I mean, I saw a young widow who asked to see her late husband's body before it was moved to the mortuary. Now, some might say, no, don't see him that way. Remember him only as the vivacious, very buoyant and vibrant young man. No. If you allow that, you would be perpetuating that first stage of denial. If you allow to see the dead body, the corpse, whether at the morgue or before the morgue, it will really help to make that loss real. And once it is, the person can deal with it and resolve it. Yeah, so these are practical ways by which you help people to grieve. And you can see that I have not attacked the issue of whether one way of expressing the grief is proper or not. That word proper would be difficult to define in any given set of circumstances. It will be quite, it will be diverse, it will be unique to the individual or individuals involved.
Wow. Oh, that's a lot to take in. Thank you very much. So yes. I know there are so many, like you said, you mentioned the cultural aspect of grieving, or is it mourning now? I should call it mourning grieving.
Yeah, grieving, but that's mourning, yes.
Yeah, mourning the person who has died. I know there are, I don't know, in your profession, have you seen some, I don't want to say weird, but have you seen some cultural things that you would have thought, if you are not from that culture, you would have thought, that looks strange, because we are all learning here now. In case we know someone who says, oh, this is what I want to do to mourn this person, it won't be, oh, this person has gone, this person has a mental illness. We'll see it as that is the culture. So have you seen different cultures? Can you give us examples of different cultures that you've experienced, or you've seen or you've heard, how people mourn? I know some people say, oh, they invite people to come and cry with them cry for them or cry with them. I don't know. I don't know, those criers or something like that. So there are different things that happen. I just want to know. And if you're watching, you know of any cultural way of mourning that might sound strange to some people but are normal to others, please share with us on this in the comment, post a comment, please. Yes. Okay, over to you, sir.
Yeah, to a large extent, I think the interesting thing about culture is its relativity. So again, it will be difficult to say that one form of mourning is normal and the other form of mourning is weird. So in my view, what is weird in a place is normal in another. So as a psychiatrist, it's practically difficult to say that some mourning practices could be weird, but maybe I could argue that certain mourning practices could be rather dehumanizing to the widower or to the widow. And such dehumanizing practices should be discouraged because ultimately they can then lead to abnormal grief as well as mental disorders, not necessarily within the context of grief per se. So the grief can then be the trigger or the precipitating factor for the mental disorder, rather than the mental disorder being an extension of the grief or part of the distortion of the grief. So I think that's the part as a psychiatrist I should address. So where you must force a person to shave off her hair because she's the widow of a deceased person. I think while it is culturally appropriate, if it's something that the widow would feel is dehumanizing, it's something that with time could gradually be phased out. But again, I cannot pontificate on culture. I'm not, an anthropologist. I'm not a cultural expert. But I think that's the element to look at. What does it do to a human being? What does it do to you, the self-esteem of the surviving relation or relative of the deceased person? In some cases, it's very easy for the relatives of the deceased to accuse the surviving spouse of having caused the death as part of their way of grieving. Then they attack that person, deprive that person of all material possessions that were supposed to be so due from the deceased partner. And that to me might be their own way of grieving or resolving their loss, but would be dehumanizing and not helpful for the person who is the surviving spouse, because ultimately it could be the basis for a mental disorder or the basis for prolonged grief or generally pathological grief. So I think that's the technical point to raise. Whatever would then affect grief negatively should not be encouraged within our cultural perspectives or viewpoints on mourning. Whatever mourning approach we choose or we adopt should be such that to preserve the dignity of the human being and not serve as a stressor, which could then lead to prolonged grief or mental disorder.
Yeah. Thank you very much, because it's so there's a fine line between grieving and then having some external forces wanting to tip that emotion over to the other side.
Something quite negative.
Yes. So there are just two more questions I have. If you have any questions, guests who are online, please ask your questions. Type in the chat, type in the comment down below, and let us ask Dr. Ogunwale the questions we have for him. So two more questions. What could happen if a person refuses to grieve their loss? Is it bottled up and they could explode? Yes.
Yeah, that would then be some form of inhibited grief. It could be some sort of distorted grief, and it could be some sort of delayed grief. In any of those instances, it will be an abnormal grief. So being abnormal, it could then be related to some untoward outcome like mental disorder, generalized anxiety disorder, or even a specific anxiety disorder, what we call a specific phobia. It could be related to a psychotic breakdown in which the person loses contact with reality and the person will be having delusions and hallucinations. It could become something that could make someone who had had a mental health problem to relapse and have a fresh episode of mental disorder. And it could also be, that sort of stressor that could lead to relationship difficulties without necessarily a mental problem or a mental breakdown. It could lead to relationship difficulties, which then would be a secondary factor in the mental breakdown at some point. So for me, I think the way to look at it is once grief is abnormally expressed, it could itself be linked to a mental disorder directly or lead to social problems in terms of relationship difficulties. And because there's an underlying conflict, psychological conflict, if it is not resolved, you will just see that there will be a lot of problems going on within that person's social milieu until the problem of the grief is largely resolved. So, for example, somebody who is grieving and is not demonstrating the grief appropriately or is inhibiting the grief, the person might actually manifest with risky behaviors like dangerous driving or risky sexual behaviors. What's going on is sex rampage in town, and not having any interest in protecting himself or herself from sexually transmitted infections and all of that. Someone might look at him and say, well, what's wrong with this chap? Why is he so morally questionable at this point in time? And why what the person is actually experiencing is that grief which is inhibited and manifesting as risky behavior. Yes.
Wow. That's profound. Thank you very much. Thank you. Finally, how? Because we've talked about different, ways in which people grieve. The prolonged one, the inhibited ones, some might last 6 months, some might last 2 weeks. Depending on how we all react individually.
Yeah.
And you mentioned something about helping people physically. Maybe if they're not unable to cook, you can cook for them.
Yes, practical help. Yes.
Yeah. So practical help. So my question is, how can family and friends help them grieve proper? That word properly is coming up again. how can without using the word properly? Okay, how can we help? How can family and friends help?
You are irretrievably bound to the word proper. I must suspect you are very proper lady yourself. So, in my view, I think, as I had said earlier on, first, let nature take its course. Don't inhibit the grief externally. Don't tell the person, don't grieve at all. Forget it as if nothing happened. Understand the different stages of grief. The first stage is one in which there's numbness, there is denial, there's a feeling of unrealness about what's happened. Your duty, your task as supporting structures would be to help the person to come to terms, to leave the sense of denial and to face reality. The second stage is one in which the person wouldn't like to eat, is unable to sleep, might hear voices, might hear the voice in particular of the deceased person, might have a very strong desire to be united with the deceased person or to be with the deceased person, might not want to disrupt the schedule that the deceased person would have wanted to keep. I remember one close relation of mine was talking with the surviving relations. I was saying, oh, the deceased person wouldn't want us to do that, as if the deceased person were still around. Now, that was part of the grieving. And it will be the duty of family and friends to say, well, the person is not around now, as we all know. Let us all sit and deal with the fact that the person is not around, and let us move beyond that point gradually. Now, that helps the person to face the reality and say, why are you moving daddy's chair from where it would normally put it? We are moving daddy's chair because we have to reorganize our lives because that is no longer here. And that takes us to the last stage of resolution, when we can now move daddy's things or mommy's things out of the wardrobe, and someone else can stay in that room. And to an extent, you sort of integrate that reality of the loss into your daily lived experience. It becomes so real that you have made peace with it, and it becomes something that translates into fond memories of that deceased person, rather than a sense of intense grief each time you think of that person. A sense of pain and anguish when you think of that person will be replaced with a sense of satisfaction that that person lived a good life and was such a beautiful thing that the person shared life with you. So to an extent, that's what family and friends should do. Just help the person to move along the stages and not try to get in the way in any significant manner. However, it's also the role of family and friends, with the knowledge we now have, that if there are red flags of being suicidal or being so depressed as to lose weight and be hopeless, helpless, and feeling worthless, it might be the duty, it will be the duty of family and friends to seek professional help and ensure that interventions are undertaken in a timeous manner and with people who are quite well trained to do so.
Thank you very much. Thank you. I can't thank you enough, because you've really shed a lot of light. So we all grieve differently. So one person's way of grieving might not be the other one's way of grieving, and so we should allow nature to take its course, like you said. Allow nature to take its course. Thank
Absolutely.
you. And you've also said from the psychiatric's point of view now that we need to discourage dehumanizing forms of mourning.
Mourning practices, yes, indeed.
Yeah. Okay, thank you very much. I haven't got any more questions, but if there are any more questions, viewers, for Dr. Ogunwale, please write in the chat and he will see them after this broadcast. Thank you very much. So practical help is important to help aid the grieving process. I hope we've all heard that, and I hope that we'll be inspired to help people who are facing grief, the grieving process, in whichever way they want us to. Some could be quiet. So and I almost have a question that how do you help someone who is not ready to help to be helped? How do you help someone who is not ready to be helped? Maybe someone is lonely and they just had a loss, and you're doing everything possible to help them. Is it at that point when you say that, oh, this person doesn't this person is suffering in silence, and you're thinking there's no one else around to help that person? What would you do? How would you help that kind of person to overcome, oh, okay, somebody is saying thank you to you. So how would you help that person to not hasten, but help them grieve without causing harm to themselves? Because like you said, there's a tipping point, there's an excess.
Yes.
And some people just want to be quiet. They don't want anyone coming to them. They want to be locked up somewhere, and it's hard for others to help them when it comes to that stage. So it's all, I don't know, God help us. I don't know what to say.
I mean, to be honest, it is very difficult to help someone who does not wish to be helped. But having said that, I think the way to look at it is, very frequently, we who wish to offer help are almost deluded into thinking that we are the only ones who can provide the help. So sometimes it's not that the individual does not want help, but the individual does not want that sort of help, and certainly not from you. So sometimes what you need to do is to be more observant, keep in touch, stay in touch, and based on your power of observation, see if you can be the bridge between the source and kind of help that the person needs and the person himself or herself.
Wow.
That would be very helpful. Rather than to think, I hold the four aces, I'm the one who would help this person, I don't see anyone else who can. Several times it's because we can't observe the individual who is suffering closely enough. We should keep in touch, stay in touch, and see if we can be the bridge between the source and type of help that the person needs and the person self for ourselves. That would be very helpful.
Thank you. Thank you very much. So abstain from being pushy at
It
that
doesn't
stage.
help ultimately. You get to become some sort of an intrusive person, and once you get intrusive, the person draws a line, creates boundaries that you can't breach, and the person becomes inaccessible to your help largely.
Yes.
Yeah, so we say just keep in touch, find a way to keep in touch and observe from afar. Somehow you eventually find the kind of help and the source of help that will be acceptable to that person.
Yeah. Wow.
And if the person wouldn't want help at all, sometimes it would be a red flag, which would trigger mental health intervention. Yes.
Okay. Helping us to draw a line. Wisdom. Thank you very much. I really appreciate your time here. Thank you very much, Dr. Ogunwale. Is there any other last words you want to say to people before we call it a day or a night?
Well, just to wrap up,
Okay.
We know now from our brief discussion this evening that grief is a natural response to the loss of a loved person through death. That this natural response consists of emotional as well as behavioral elements. We have said that grief is in reaction to bereavement, and that the culturally appropriate manner of expressing grief is mourning. That there are different stages of grief. This early stage of numbness, of denial, to the middle stage of loss of appetite, difficulty with sleep, transient hallucinatory voice of the deceased person, urgent desire to be united or wanting to be with the deceased person, or wanting to change schedules and things like that. And eventually, the last stage of resolution. That as support structures, we have a duty to allow nature to take its course, and that we provide support, engaging in practical help. And we should identify red flags that would trigger mental health intervention. That mental health intervention would include things like counseling, psychotherapy, medication, support systems, as may be the case. And on the whole, that grief being natural and allowed to proceed naturally several times gets resolved without any extreme external intervention. I thank you very much for inviting me.
Wow, thank you very much. We really appreciate your time here. I wish you all the best in your career, and we hope to see more of you some other time.
Thank you very much for inviting me once again, and I wish you the same. Have a very pleasant evening.
And you, thank you very much. So viewers, you've all heard that. You've heard it all from Dr. Ogunwale. If you need to rewind and watch this over and over again to really understand what has been said, please share, like, comment, subscribe if you want. And thank you for those who are subscribers already. Thank you for always supporting. Thank you very much, and I wish you a good evening. So till we'll see you next time. I'm hoping all of the questions we have for on Slido, we have questions have been asked generally on mental illness. Those questions will be treated next week, and we will come your way again. So till we come your way again, stay safe, stay calm, stay connected. Thank you, and bye-bye.
Particularly when you talk about depression by year 2030 is expected to account for people who suffer the most in terms of disability. So that is what we are saying, that psychiatry is really, really relevant in the world today. You cannot be well if your mental health is not well.
Hello. You are welcome again to this channel where you get educated, informed, inspired, and we kind of create awareness about things we all need to know as humans living on this earth with blood in our veins. So yes, today we are going to be talking about psychiatry. And when I say psychiatry, that brings up that lights a bulb in your head about mental well-being. So I am very fortunate to be with a friend of mine. She was in Yellow House, I was in Red House. And we come a long way from Fejikola, that was Federal Government Girls College, Akure. And the funny thing about it is we haven't spoken for decades, but we've been on the group chats, chatting and all of that. So it was nice for her to actually accept to do this interview, despite us not having been able to speak for a long time. So anyway, without further ado, I will call on Dr. Folake Ogundele. So Career Talk on Psychiatry today, I welcome on the screen Dr. Folake Ogundele. I almost said Owolowofela. You're welcome. Thank you very much. So,
thank you. You're welcome.
Would you like to introduce yourself, please?
Folake, I like my first name, Folake Ogundele. I'm a psychiatrist. I work in Abeokuta, the neuropsychiatric hospital, Abeokuta. I'm a mom, a writer, a drama artist. I'm many things in one. I'm a wife. I'm many things in one. So I juggle all these things together.
Wow. And yeah, and by the way, she writes so well. She writes so well that when you read, you just want to keep reading and reading and reading more of her writings. She's very good. So you're the best person to talk to us today about psychiatry. So what is psychiatry about, and how is it relevant in the world today, especially in the season of COVID-19 pandemic?
Okay, so psychiatry is a field of medicine. It's a field under medicine that deals with diagnosis, treatment, prevention of mental disorders generally, mental disorders, emotional disorders, and psychological disorders. So if you have people who have challenges with mental well-being, in at-risk groups, that's what a psychiatry would do, help them with these challenges. So that's essentially what psychiatry is all about. It's a field of medicine. You have to be a medical doctor to go into psychiatry. There are other mental health professionals that we work with, but for psychiatry, you need to first have been into medicine. You will graduate as a doctor, and then you can now go for your residency. You go for your residency, that's postgraduate studies in psychiatry, and then you qualify after some sets of exams as a psychiatrist. So you can then work as a psychiatrist. So how is psychiatry relevant in the world today? How is psychiatry relevant in the world today? For a lot of countries, you would find out that so many things are happening in the world. Particularly in this COVID area. COVID was an unexpected happening. It was an uncharted territory. Nobody knew anything about it before it started. And then this is something that's associated with a lot of morbidity, mortality. And it's also affected the economy of most countries. A lot of countries are just bouncing back from the effect of COVID. So how is it relevant? Anywhere you have suffering, anywhere there's disability, anywhere you have stress, anywhere you have disasters, people react to it. People undergo stress. Anywhere there's stress, people have complications in terms of their mental well-being. And so psychiatry is an area today that is really, really relevant for you to have a good society, a society that is productive, a society that is functional, for people to be able to cope with their day-to-day challenges, they need to be mentally well. And that's where psychiatry comes in. You find that there's increasing rates of mental disorders, increasing rates of suicide, increasing rates of drug and alcohol use, substance use disorders all over the world. And even when you talk about some non-communicable diseases, psychiatric disorders are in the front. Right now, psychiatry account for about 11% of the disability that comes from non-communicable diseases. So it's really, really relevant, particularly when you talk about depression. Depression by year 2030 is expected to account for people who suffer the most in terms of disability. So that is what we are saying, that psychiatry is really, really relevant in the world today. You cannot be well if your mental health is not well.
Thank you very much. You cannot be well until your mental health is well. And, you know, the way our brains are wired, it's such a very sensitive organ of the body. You know, just like the heart, the brain is very sensitive. And I'm not a medical doctor, but, you know, with so many things that are going on, it all starts from the brain. Even when you have a pain in your arm, is all the brain, you know, giving you signals. So you are doing a wonderful job going into that field. If I may ask before the next question, why psychiatry? Why not maybe general practitioner or orthopedic or any of those? Why was that? What steered you up into psychiatry? For those who are listening and thinking, oh, I actually want to do psychiatry, well, maybe your story would help them to make a right choice.
For me, why psychiatry? I chose psychiatry because I think, one, I could relate with the field. I could relate with the patients. There's a lot of stigma associated with psychiatry. And when people see people that have challenges with their mental health, we tend to snicker, we tend to make fun of them, mock them. You know, there's a lot of stereotypisms, there's a lot of labeling when you talk about psychiatry. But I see people with mental health challenges as normal. And I see myself, you know, I see how they break down. It's not unusual. It can happen to anybody. Anybody can have mental health challenge. You are not special. Like I tell people, unless you're dead or you're not yet born, that's the only immunity you have against mental health. So I had this empathy. It was easy to empathize. It was easy to say, oh, if I have this challenge, I want somebody to be objective, and I want somebody who will pay attention and would really enjoy, you know, helping me to get better. So I think that's one of the reasons why I chose psychiatry. And then as I like to also see it, psychiatrists are very objective people. We see the patient globally. All other fields of medicine, they attend to just their discipline, you know, just that area that they are concerned about. You cannot see a psychiatrist and that person will not be concerned about even your physical health, your social life, your emotional well-being, your finances. We look at the patient holistically. So we see you, we get it, we understand, and we're objective. And that's why I like psychiatry.
A lot of compassion, empathy is needed for this field. Thank you very much. And I know you're very empathic. You're a very compassionate person, and I'm really blessed listening to you. And I'm sure there are people who are out there who are like, oh, I want my child, or my child wants to go into psychiatry. What advice do you have, and all of that? So it's nice that you're here talking about it. And meanwhile, viewers, if you're listening, you've got questions, just write them in the comment down below, because Dr. Folake is here to answer all of your questions. And next question, I know you've mentioned a part of it, but if you want to itemize, how do I know? How do the young people watching, how do the younger generation who are watching this now, or who have children who want to advise their children, how do they know if psychiatry is for them? Could you itemize? I know you've talked about being compassionate, having empathy. Are there other qualities you think people need to have to?
Well, for you to be a psychiatrist, first and foremost, you must go through medical school. That's the number one prerequisite. And then do you enjoy during medical school? You would have gone through the psychiatric posting. So during the psychiatric posting, how was it? Did you enjoy it? Could you understand it? Did you have empathy? Were you able to patients? Do you see yourself enjoying it? Is this something you can live with? Is it you? I think you just know. Now the problem is with maybe the parents or the significant people, because of this stigma treated with psychiatry, a lot of people that might want to do psychiatry, they end up dropping the discipline because the close people to them, they usually do not agree. So I would say that give the person a chance. At the end of the day, it's important for everybody to love what they do. So you must enjoy what you do. You must have that job satisfaction and feel that what you're doing is has its own worth and your contribution to society. So I would say that is really what matters. Do you enjoy it? And then you must be objective. Not every times you will need to say, oh, this is a medical condition, not totally a functional illness, a psychiatric illness. There are times you will need to be objective, and if you do not agree that the person has any form of any major psychological challenge, you need to be able to state it. So you must be objective, see the patient holistically, and I think you must also enjoy talking. You cannot rush. You need to understand the person. You need to understand your clients. So it's not a field of medicine where you just rush. You see the patient and then you're gone. You must be able to enjoy spending time with patients. It's not just a quick diagnosis and then you understand what has been happening in the person's life for the past 30 years, for the past 60 years. You need to sit down and really, really understand. So if you are not that kind of a person that you like talking, you like sitting down for long and staying with people, then maybe that's not for you.
Thank you. So the main thing actually is that you need to go through medicine. You need to start off with wanting to be a doctor, a medical doctor. And from that, during postings, if it's psychiatry or it's pediatrics or whatever it is. Okay, yeah, that's so. The first, for people who are in secondary school who are thinking, I've not even done any. Some will say JAM, some will say GCSE, some will say A levels. Different countries have different routes to getting into medical school. So for those who are in secondary school, who are choosing their subjects, what would you think are the subjects they need to start looking at?
Science courses, biology, physics, chemistry, and then in Nigeria, the prerequisite maths and English and mathematics.
Okay.
So
okay.
5
So
very
if one of
important.
the sciences are the backbone, they are the backbone of being a medical doctor, and from there you can now specialize into psychiatry and all of other fields of medicine. So thank you very much. I want to ask you the next question because you've already mentioned when you were talking about having a work experience, it would help you to decide if you really want to go into psychiatry or not. So I want to ask you that again. But what steps can I take to be relevant internationally? Some people are like, oh, is the way they study psychiatry in let's say Nigeria or Ghana or South Africa is different from the way they do psychiatry in the UK or in other Western parts of the world or US or Canada. So what would anyone need to do to be relevant internationally? I'm not sure if I'm right. Psychiatry is different in other parts of the country. But I'm just saying people might have that notion that, oh, is it different? Is it the same? If it's the same, what can I do to be relevant internationally?
I think what may be different are the processes of qualification as a psychiatrist, the exam process. But once you qualify in your area, you may need to be accredited in another country. So, but once you're a doctor program anywhere, if you're accepted, if that country would accept foreign students. But in Nigeria, once you're qualified as a medical doctor, you go for your residency. Once you finish residency here, if you want to travel abroad, I know particularly to the UK, you need to pass your English test, and then there are 2 or 3 stages of exams that you would do, and then you can practice in the UK. Essentially, psychiatry is the same. You know, it's the same. We use the same diagnostic methods. Of course, there are differences in phenomenology between country to country. The way a black man would, an African or a Nigerian may present with features of psychosis, for example, may be a bit different in terms of cultural influences to how somebody in the UK. But at the end of the day, psychosis is psychosis. We use the same criteria to make our diagnosis. So it's still going to be the same. So if the country allows foreign practitioners to practice in their country, then they would take you to your country as being standard. The training in your country as being standard. But other things you could do to be relevant internationally, you need to be good in your place of practice. You need to be able to give your place of practice. If you are not good in Nigeria, you will not be good anywhere else. If you are not giving your best care, you will not give your best anywhere else. And wherever you're working, one of the things the world is looking at now is advocacy. Wherever you're working, in the rural area, in the urban centers, Western, African, Caribbean, wherever you are, advocacy for people with mental health challenges. We need to advocate. If you are into psychiatry, you must advocate. There's a lot of suffering, there's a lot of care burden that's wrong. And once someone is ill, the society is also ill. So advocacy, it's if you are advocating and mental well-being, then you will be relevant internationally. And then if you are able to go into research, and you are doing research, conducting research that are of global importance. Like now, I think COVID is one of the relevant issues globally. So if you are able to conduct research that are relevant to the needs of your environment and the global world, then you will be relevant internationally. If you're able to meet, there's what we call mental health gap. If you're able to help patients bridge that gap, whether through your advocacy, whether through research, whether through you're giving your best in your place of practice, then you're relevant internationally. And I think those are the things we need to focus on.
Yeah, thank you. So writing papers and all the research. Yeah, well done. Thank you very much. Thank you for this. So what is your favorite famous quote or a Bible quote, and why?
Favorite quote, I have many, and I think it depends on whatever I'm going through. That determines what my particular quote will be. But one thing, a quote that I like, I really, really like, I try to use it as much as I can, is that one from Corinthians that says, praise be to our God, the God of all comfort, who comforts us in all our troubles, that we, having received comfort, may comfort others. That gives me a sense of hope. That tells me that whatever you're going through, no matter how difficult, no matter how hurtful, how painful, you can help others. And I think that's essentially what psychiatry is all about anyway, that is hope, that you can help others. It doesn't matter where the stage in which you are, whether the suffering is still much or not, you can still impact. We need to impact and help people. There must be a reason for whatever negative thing we are going through. So that gives me hope. I think I tend to use that a lot, especially in my field. You know, I don't need to say it to patients. There are patients that are not Christians or may not appreciate you preaching, if quoting Bible passages, not preaching. My work as a psychiatrist is not exactly about preaching, but quoting Bible passages. But in my mind, when I'm working, that's what guides me, tells me, help this person. This person can still help another person.
Thank you. Out of curiosity, I'm just wondering, has faith helped people in their mental stability, or has it actually, well, I mean, has it acted as a positive more, or is it more of a negative to people? I would like to comment.
It's more of a positive. I'm a Christian. I'm also a doctor. And having faith, even when you see patients who are, who are resistant to treatment, it helps me keep hoping. You don't get discouraged easily. There's a lot of burden too when you talk about psychiatry amongst doctors. Doctors also have a lot of burden for patients, and sometimes there may be burnout. So having faith helps me, keeps me going. And then for patients too, talking about suicide, it's helped a lot of patients that I've seen to hold on from actually going the whole way. When they begin to have suicide thoughts and suicidal behaviors, that faith helps them not to complete. It gives them a restraint. So I've seen when you ask the patient, so have you tried to kill yourself, or have you done anything really dangerous to yourself? And then you hear them say no, and say why? I say because I know God will not like it, or I know that God can still help me. So it helps them a lot. It really, really helps them a lot around here. Another way that our religion and health is in terms of social interaction. Some of our patients, by reason of their illness, they withdraw to themselves. They lose their social skills. And when they do that, it's more difficult to rehabilitate them. It's more difficult for you to get them back to the society, to work, to marry, So what religion does is to give them an atmosphere, that is suitable for them to mix with other people. It's especially if it's not a toxic environment. If the community, that faith community, their understanding, they help the patient to reintegrate back into the society. Some actually get them treated and get them into the community. So it's really been more positive than negative. But sometimes, in terms of faith, in terms of religion, you really do have negative setbacks. Sometimes, a lot of times in this community, when the patient has mental health symptoms, particularly the severe type, they take them to faith houses. And sometimes really there's a lot of suffering. Some really bad, nasty practices go on in some of these places. So those are negative, and then sometimes patients will not comply to medication based on this faith, and they keep having repeated episodes. So those are some of the negative aspects. But in terms of the positive aspects, we do see a lot, and we work with people who give us positive results. We are open to accepting help from faith houses if we count it as positive, if they have a positive influence on the patient. But we are very guarded when it comes to letting them have input. We are very selective.
Thank you. Thank you very much. I'm sure there'll be people who are listening who have just joined us who will be thinking, oh, I have got a question. I've got a question. Can you answer this? At the moment, we can't take the question. I mean, we can't answer the questions, but please write in the comment down below, and Dr. Falake will be answering all your questions when it's when this is made live. Selecting psychiatry as a career for the younger generation. Is there anything you want to encourage the younger generation about?
Psychiatry as a career, it's awesome. You can you can easily get that fulfillment. You can walk anywhere. There's psychiatry everywhere. You're not limited by time, by space, by even technology. Nothing limits you. At least 1 in every 5 individuals would have mental health challenges. So they are all around us. And it's fulfilled. You can build lives. You can have beautiful impact into people's lives. And I would encourage anybody that is thinking about it to go all out for it. It's a wonderful field. I've never regretted being in psychiatry. Thank you very much.
Thank you, thank you, thank you very much. I really appreciate your coming on this platform to tell us about psychiatry and how it will benefit the next generation, and encouraging and inspiring them to choose psychiatry. Thank you very much, Dr. Folake Ogundele. I really appreciate you, and I'm sure our viewers really appreciate the time you spent with us. Thank you. I know you're very busy. You need to go back to stuff you need to get around at the moment, and it was nice getting that part of your time, sharing the part of your time with us. I pray that every time you work with patients, that they will get better, and the Lord will give you ideas, will give you, inspire you, this will give you discernment, will give you more gifts on how to treat patients and how to get into their heads, and even speaking words that will liberate them in the name of Jesus. He will empower you, will grant you the mantle, and you continue to be a light to those who need light in the name of Jesus. God will empower you more, and I pray that more of people here. So maybe when we have so many questions again on the platform about it, it will be nice to have you back to answer those questions. So thank you very much for your time. I really appreciate it. I love you so much. Thank you. Thank you. God bless you. Have a good day. Bye. Bye. So thank you very much, viewers. You have heard it all from the expert. So please type in the comment down below if you've got any questions bothering your mind and you want to know anything about mental health you want to know. Please do not hesitate. Write it down in the comment down below, and I will link you up with Dr. Folake, who will be able to answer all of your questions. Thank you for watching. You've been awesome coming here to listen. I wouldn't be doing this if it's not for your support, if it's not for you coming in to listen and being blessed. So enjoy your day and have a lovely, lovely, lovely day. God bless you, and I'll see you next time. Bye-bye.